Recording in progress.
It's now 6:07, if that's correct, and I'll call the meeting to order. Before beginning, I want to note that we've made, those of you present can actually see it, some changes which we hope will increase the efficiency and make for a smoother board meeting. So among those features are a podium, as you can see. So when we recognize a speaker from the public, we ask you to go to the podium and please make your remarks there. So it's always clear who's speaking. That's the first thing. We have now have nameplates for our directors. Unfortunately, we didn't. Somehow we didn't get one for Director Finney this evening, but so that the members of the public, especially the ones that are viewing in, know who's speaking, which I think is very important, and that will make hopefully a difference. In addition to that, we've covered the tables so that we look like we're conducting business. Our hope is that these environmental and structural kinds of things that we're doing will make these meetings more effective and more efficient, and then we'll do a better job of conducting the public's business. So with that, let me begin by introducing some special guests we have. First of all, we have Ms. Sofia Salviano, who's the CEO of RGS, joining us, along with another member of their team, MJ Brown, who's a certified municipal clerk and expert in all things Brown Act. And then if I believe, we just, another guest tonight, we're happy to see him, is Mr. Jim Hurst, who's chair of our Measure C committee. We welcome him and look forward to his remarks as well.
And Dr. Miller.
Now, want to mention that we, as we work toward improving our processes, there always are some things that aren't. There's always something else that surprises you. So we have a little bit of a timing issue. We want to make sure that people in the audience also are able to see that. And we thought we had that resolved, but apparently we don't. But our folks from Mendocino High School Marshall and guarantees us that we will have that fixed for the next meeting. So please be patient with us as we make our transition. We expect that going forward from now on, considering all that's at stake, that we're going to draw a lot more public attention. And we think it's very important that we be prepared for that and welcome everyone, make sure that everybody gets an opportunity to speak. We need all of your thoughts, even if when we may not agree, we need your thinking. So we want to have an open environment. Okay. So let's, can we start with roll call then, please?
Okay, who's Tim? Okay. Okay, Paul Garza.
Here.
Paul Katzef.
Here.
Susan Savage, here. Sarah Spring.
Present.
Lee Finney.
Here.
Okay. Now, before we begin public expression, I want to point out that this is a more complex agenda than we have done for some time. It's also the first time this Ms. Wiley has compiled it, and she's spent a lot of work on it. We inadvertently left off the public comments at the end of the meeting. But as chair, I have certainly the discretion to, despite the fact that it wasn't published, to allow it, and we will entertain public comments at the end of the meeting. I do want to, however, observe that while that has been the practice, it's up to the board to decide whether to continue that practice or not, so going forward. With that, I'm now ready for public expression. Oh, let me make one other thing. I want to make a note. We had a little bit of a problem with the getting the correct documents up for record retention, where Ms. Wiley resolved that today. So apologize if that has confused any of you. But that has also been resolved. Apparently some documents got attached that weren't intended to be attached. Okay. Now open for public expression. Linda W., is that Linda Williams? Is that correct?
Yes.
Okay. You're recognized. Linda Williams? Ms. Williams, are you on mute by any chance?
Or her computer might be, even if she isn't.
Okay, well, I don't know what's going on. Can we move on to Ms. Shattuck? Ms. Shattuck, you're now recognized.
Am I up now, Jenny Shattuck?
Yes.
Yes.
Okay, thank you. I was wondering, I didn't see it necessarily as an agenda item, so this is why I'm asking now. How many of the emails went out for the survey? And was there a certain list they went to? Because it seemed odd that the only people I know that received the survey were people that were already on a prior email list for the district, but none of my neighbors or family members or anybody else I know has. And I just wanted to, a few meetings ago, I went and complained about some of the care that was at the hospital. And I will say tonight that I was pleasantly surprised when I had a family member go into the emergency room and had to be admitted to the hospital. What a difference it was when there's a qualified doctor that listens in the ER. And it was not a good outcome in the end for the person. They passed away, but they got amazing care. And so just like when I complained, I will also give credit where it's due. Thank you.
Okay, is that better? Okay, no, I just called in on my phone, so that might make a little bit of a difference. So first of all, thank you, Chair Garza. I'd also like to thank Mr. Hurst and his committee for having the Measure C meeting that I attended via phone on Tuesday of this week. And it was my first time attending, and I don't recall there being any other Measure C meetings in the last year. I could be mistaken on that. Just a couple of notes. The meeting was called to order, and Mr. Hurst began to discuss the items on the agenda in a very orderly manner. Director Spring came into the meeting late and immediately began to disagree with the numbers that Mr. Hurst was presenting. She didn't wait to be called on by the chair, and she wasn't compliant in keeping with the allotted 3 minutes to speak. She appeared to almost try and take over the meeting, which was making it very disorderly. When she was asked for supporting documentation, she didn't have any hard copies that I could see to provide to the committee or bring them to help the committee do their job. In my opinion, her comments were off the top of her head. It's my understanding, and again, I could be wrong, but isn't the MCHCD treasurer supposed to be providing the financial information to the committee? Instead, she disputed the numbers that Mr. Hurst was providing while not having any hard copies to prove her points. It seems that Director Spring is always throwing a word salad around, creating confusion and questions, instead of providing the documentation she's responsible for obtaining. Couple questions. Why haven't there been any of the quarterly meetings that are required for Measure C? And along with that, since Director Spring has been the treasurer, there haven't been any financial committee meetings or monthly P&L reports presented for the public to review. So another question, when's the next financial committee meeting? When is it going to be scheduled? And just in a closing comment, if this is the way the board's going to continue to perform, I don't see how you're ever going to get the bond issue to pass, especially with numbers being thrown around without the factual documentation. People want to see the facts and not hear them. Thank you.
Thank you for your comments.
Sure.
Any other public expression? Mr. McDonald?
Thank you. Wasn't going to say this, but I was at the Measure C committee meeting in person, and that wasn't the impression I got all the way through. And the documents are there for this meeting if Linda wants to look for them. Anyway, I'm glad to hear that the chair is acknowledging that public comments at the end of the meeting is important. I don't care for the phrasing of it's at the discretion of the chair, given that, as I wrote to this board in a lengthy letter, this is a long-standing practice, and I was amongst the people who had to fight for it in the 2010s for it to occur to begin with. So, and I expressed this to Kathy when I met with her before, at the beginning of her tenure here, informally met, that if we're going to be taking away any type of public input, that's not going to sit well, and I will take it personally, and I will report on it. So you can take that however you want, the last part of it. For the people here from RGS, they should know that at the last meeting, which was a special meeting, public comment on non-agenda items was quashed by the current chair and the preceding chair. I guess I don't know whose input did that. I wrote a lengthy letter to all 5 board members about that, pointing out that at best, the Brown Act and the government code specifically about special meetings is really a glass half full, glass half empty situation. And this board, specifically its leadership, had chosen the glass half empty or the lid on the glass as far as input from the public at special board meetings. And that this also is breaking from a long-standing practice of the predecessors to these board members. If it ain't broke, don't fix it. That's the first thought that came to mind when reading this agenda. So to try to just keep it away from the agenda itself, the setup of it needs to revert to, let's change attachments to tabs, back to tabs, I should say. Board comments should be happening right after this section, not in some sort of board report later in the meeting. And there should be board input again at the end of the meeting. That was the trade-off years and years ago for having public comment at the end of the meetings. I feel like this is kind of a show for the RGS people in attendance. When that, are we going to address that? I want to address that this 3-minute clock has been here since November 9th, about the time that Mr. Garza, well, anyway, since then, we've had 2 meetings a month since then. There have been attempts to cut off public comment, in the middle of cogent talks about agenda
Please
items.
wrap it up, Mr. McDonald.
I
You're
will.
over time.
I think this is important. And this isn't their first attempt, this is their first attempt to think about, to get Marshall or whoever to hook up the people on Zoom. The people on Zoom have had no.
Okay, your comments, your time is up. Is there other public expression, please? Anyone else want to speak?
There you go.
Mr. Maroney?
Good evening. I just want to mention, it's a cool setup. Maybe cloth, I don't know, the plastic looks kind of weird.
Yeah, maybe close.
One thing is, it would be cool if there's going to be a 3-minute clock, just that the speaker can see it. Because I'm kind of like, I really can't tell.
Okay, we
Where it's
thought
at.
we had it, but okay, I appreciate that.
Okay, no, yeah, I can see it now, actually.
Okay.
But, just, maybe something big and red. That was just my only comment. Anyway, thank you.
Okay, any more public expression at this point? Okay, let's begin with reports. Before we do that, let me just note that as we try and work on process, it's important that the board also observe that process as well. So after reports, whether they come from the public or members of the board, we're going to ask the board is now then going to have an opportunity to ask questions to the presenter, all right, and to seek clarification. This is not a time to take a position or express an opinion. After that, we will go to public comment, okay? And once public comment closed, then we'll come back to the board, and at that time, the board has their opportunity then to start debating the position. Hopefully that's clear? Mm-hmm. Okay, we're going to try and follow that. So the first report is from Judy Leach. Ms. Leach, are you online now?
Good evening, I certainly am. Thank you so much for allowing Adventist Health Mendocino Coast to give you a regular update. I have chosen to do this from my office simply because it might be easier to share a screen. So if I may ask for your permission to do so at this time. And what it says is host disabled participant screen sharing. Perfect. Thank you. I also wanted to comment on the gracious remarks that Jenny Shattuck made earlier and appreciate that feedback. We're always welcome to hearing feedback, opportunities for us to improve, as well as those comments when we are meeting the expectations of the community. So thank you. Are you able to see my screen?
Yes,
Well,
almost.
Beautiful, thank you. Well, let me start at the very beginning and let you know, as we start this new year, we do so with appreciation, gratitude, and continued focus on our patients. Our patients are going to be at the center of every decision we make. You recall December was a very challenging month as it related to a health plan. Blue Shield did come back to the table the week of Christmas. We were very pleased that we did reach a negotiation with Blue Shield across the state of California. The issue that we had was not just at the Mendocino coast, but in every community across the state where our services are made available. I also wanted to give the public a chance to see of the various health plans that we do accept, the products that those cover, and also what those include. And so individuals often will have questions about their plan, their coverage, we encourage them to always reach out, number one, to their health plan, and also to allow us the opportunity to work with them and to be an advocate with their health plan should things need to be escalated. But most importantly, the right source is the state of California. Anytime there might be questions regarding a health plan, the state does have an advocacy area in which one can approach for any questions that they might have. Today, I'm going to briefly talk about the most asked questions that I get. So here you go. One of those questions is, tell me about the office visits. In other words, our clinics. I'm pleased to let you know that in 2023, we saw about 37,000, nearly 37,500 clinic visits here on the Mendocino coast. I will tell you, I was surprised by that number because it's much higher than I was anticipating. And to put things into perspective, this week alone, we will have seen 865 patients in our clinics. It puts things in perspective because so often we are challenged when it's a hard opportunity to get an immediate clinic visit. But when you see the number of lives that we are treating every single week, I'm very pleased to be able to tell you, as you can see from this graph, that access to care has consistently grown from year to year. The medical office also is comprised of providers, as you know, and pretty soon you're going to see what that looks like from a recruitment standpoint. But here you go. This shows you a graph year after year on the growth of us being able to recruit new providers to the coast. Here's a little bit of what that recruitment effort looks like. And I'm sharing this for you across the county, but that very first bullet point is the coast. So you can see that right now we are recruiting for primary care, in other words, family practice, internal medicine. We have all of these specialties, as you can see on your screen, including general surgery, cardiology, GYN services, orthopedic surgeon, geriatrics, GI, pain specialist, among others. You'll also see a listing here of what our other hospitals in the county are recruiting for. As you know, Ukiah has a residency program, and so as a result, we are also recruiting for faculty at Ukiah. But I wanted to be very transparent with you and have you focus on that very first bullet point so that you can see where our energy is being spent in order to respond to community need. Now, are there other specialties that are needed? Absolutely, in every community across this nation. But these are the areas that we at the coast have seen to be the highest need based on the care that we provide through our clinics and also through our ER. We base these decisions not on one-off criteria or incidentals or even emotion. We base this on the metrics. And so I just wanted you to be really clear of where our energy is being spent. Here are some of the new providers that are joining us in this community. You and I can be very pleased that we have internal medicine that's going to be joining us here with Dr. Arbuck. Dr. Arbuck will be internal medicine and likely will be housed at our Sequoia Circle location. We'll let you know more as those details emerge. You'll be seeing her here during the first quarter. Caroline Wells is joining us in our oncology department, and Kathy Boyle will be joining us providing pediatric services. We've also got additional specialists in this community. If you've been back to the clinics recently, you will be delighted to see Jennifer Brown back in town. Jennifer was with us previously, had such a good experience at the coast that she wanted to return. Dr. Heilbronn joins us in general surgery. As you know, Linda James, along with Dr. Ken Sussman, provide general surgery services here on the coast and have for decades. Dr. Heilbron, who has been with us for the last several months, filling in for Linda James, has had such a good experience with this community that he will be joining us 1 week a month to start with as he builds his practice here and as he sunsets his practice in Southern California. Dr. LaMonica has been joining us at the Sequoia Circle location, providing urology services on the coast. It's part of our strategy to have care close to home. And very soon you will be meeting Maxine Webster, who will also be joining us in the oncology department. As you know, that's one of our busiest services here on the coast for specialty care. Some of you had the pleasure of meeting Dr. Nalamathu on your screen because Dr. Nalamathu is providing pulmonary services at Adventist Health Mendocino Coast. I want to say thank you to Dr. Miller, who is in the room with you tonight, for helping coordinate these services. But pulmonary care is available for our local residents. Here's an email, and I'll tell you what, I simply copied and pasted this, did not make any edits to this, so you're seeing it exactly as was sent to me this morning at 10:18 from a local patient. As I started this presentation, I told you I'm as interested to learn about ways that we can improve our care to our local communities as I am hearing when we do things right. So here's a message today from as you can see, Gary Quinton, a longtime resident of the Fort Bragg area living in Westport. He says, for the past several years, I've had many problems, the result of a saddle pulmonary embolism. Again, on Sunday, January 20, I had to check into your ER. Then again, the problem persisted and I had to revisit the ER. On Tuesday, then Larry, Dr. Ramirez's assistant, called me in for further consultation, which resulted in me checking in back into the ER. The wonderful care of your ER staff and doctors have provided me over the years is just like that, just like it was this week, unexplainably good. It makes one glad to be an American and live in the MCDH service area. Dr. Colfax performed a cardioversion on me Wednesday, the 24th, and fixed me right up. On Sunday, I could not walk 10 feet without being completely exhausted and very scared. Today, I feel like everything is working as it should. Please express a big thank you to the entire staff for the wonderful service. Adventist Health is the best. Now, not every letter I get is this type of letter, but since this one did come in this morning at 10:18, I thought it was timely and that you would want to know about it. Here's what it looks like for us investing in our community. We talked about these numbers that I would bring you in a previous meeting, but here they are for you to see today. The total wages, benefits, and contract labor that we have invested in this community has been $44.5 million this past year. You'll see what the leases and rentals look like there. The professional fees that we pay to providers just last year alone was over $10 million. And the purchase services that we bring in order to keep healthcare here local in this hospital is an additional 5.7 million. With any organization, I'll use schools, for example, you take the total investment and you multiply that by a factor, which tells you what the costs, indirect and induced impact is for the community. For example, with schools, it's about a 3% or 3 times that direct spend. For healthcare, based on the investment amounts, it's about a 4 to 6 times that direct spend. So I'll let you do the math on this, but these are real numbers in front of you, and I want to say thank you for the opportunity that you have given us to serve this community. It would be helpful for all of us to see that the investment being made is one that also represents a commitment to the community. Recruitment and retention matters greatly to us. And so back to the reason that we share some of these numbers with you, you'll see that as of December, we were able to recruit nurses, 13 nurses, 19 clinicians. Again, these are new members to our hospital. But when you look at people who have transferred into nursing, maybe from a different department, that number rises to 22. And for clinicians, that number rises to 33. You'll see the breakdown there, but I'm pleased to also let you know that in total, we were able to bring in 64 new members to this community last year alone in order to make sure healthcare could remain local. I'm going to close out with this slide. This is what our strategy is based on. A few weeks ago, the executive team of Adventist Health, Mendocino, and Lake counties gathered together with Judson Howe, and we put together our strategy. I'm sharing it with you today because I think it's important that this community knows that it includes expanding primary care access back to more internal medicine and more family practice. We have a commitment in our strategy to achieve top decile, meaning we're measured not against ourselves or other hospitals, even in our county. We're measuring this against the nation to be in the top decile in patient quality and in safety. This is that journey for every patient, every time receiving quality care. Will we sometimes slip up on that? The answer is yes, because healthcare is not a commodity. Healthcare is delivered by human beings. But I'm also very pleased to let you know when that happens and things don't go as planned or as we would hope for, we're going to own it. We're going to own it, though, with that patient and with those involved. It's not going to be something that is based on hearsay, innuendo, or an assumption. It's going to be based on a relationship with the person that has been impacted by it. So that work of being in the top decile is also a work of just culture, where staff members feel very confident in speaking up when things don't always go as they had hoped for a patient. It is about creating a culture based on trust and a culture based on respect. All of that's part of our work in our retention and our recruitment of the staff that we have. And you'll see that keeping care local is very much part of our 2024 strategy. All of this builds a foundation of a pathway to sustainability. Healthcare is probably the most challenged that it has ever been. I spent a day with the California Hospital Association last week, where all rural hospitals came together and spent a day talking about that which excites us in the delivery of healthcare and that which challenges us. And I will tell you that hospitals all across this nation are facing the same challenges and the same opportunities. The greatest challenges are based on the fact that reimbursement continues to drop for hospitals across the state. Medicare, Medicaid, and payer plans as well. Meanwhile, the cost of delivering healthcare continues to rise astronomically based on wages, based on supply chain, and based on pharmaceuticals. And so our commitment to this community in 2024 is to do all we can to create a pathway for sustainability so that healthcare can be local. With that, I'm going to stop sharing my screen and be glad to answer any questions from the district board.
Okay, thank you. The board members have any questions for Ms. Leach?
Yeah, I have
Okay,
one.
yes.
I have one.
Vice Chair Katzib.
What do you mean by sustainability? What is your definition of sustainability? It was the last criteria that you're aiming for. I'd like to know what that means.
Thank you. Great question. Sustainability means the continual evaluation to determine that your strategy is the right strategy in delivering care. So for example, I will use hospice services. Having hospice services on the coast is really important to us. In fact, we started that journey last year because it has to be a certified process. Ensuring that we can have a sustainable hospice for the future is what our strategy is based on. That means being able to recruit nurses who are licensed to provide certain services, such as hospice, being ensured that we have surrounding services to deliver that particular line of care. And so the sustainability piece is we're doing evaluations every single month, from labor to make sure recruitment can be all that it can be, to make sure that we have physicians at the top of their practice, to make sure that that is a service that this community needs based on, again, measurement, not hearsay, but as we look at the data. So sustainability is, what does it take to keep these services local, not just for 12 months, but for beyond that too. Did I answer your question? Thank you.
Other questions from board members? Okay, we'll entertain some questions from the public. Mr. McDonald, you want to be recognized? Please stand at the podium.
Thank you. Thank you, Judy. It's encouraging to hear the recruitment news.
Mr. McDonald, I'm sorry, I can't hear you.
Oh, it's encouraging to hear the recruitment news
Thanks.
and also the continued attempts, to have the highest level of care. I have two questions that kind of are wrapped together, but I think are separate. Has Adventist Health done a study on the cost of constructing a new operating room OR and an urgent care? And I'll leave it at those two parts. And the second half of the question is, if that was done, can Adventist Health or will Adventist Health contribute any of the dollars to do that, or is it expecting the public of the coast to do so? Thank you.
Excellent question. Thank you. We do have a lease agreement in place that I think is rather specific on services. Can we get cost estimates for an OR or urgent care? The answer to that is yes. We do that across the state, and we use the same benchmarks in all of our facilities to do that. Have I done that here at the coast for OR or urgent care? The answer would be no, I have not. But we certainly can, because we do have those resources. And Peter Johnson is in the room, and Peter works very closely with the entire team across our continuum that evaluates costs on a regular basis.
Okay, are there any more questions at this point? Okay, thank you for your report, Ms. Leach. Thank you very much. The next item is the Mendocino Healthcare Foundation report. I note that Terry Ramos is not here this evening. We thought he would be here.
Yeah, Chair Garza, he let me know he couldn't attend tonight.
Okay. Is there anyone else from the foundation who is prepared to present a report? Okay, seeing none, let's move on. My report is very quick. I wanted to note that in the agenda package that was published, there is a very important report. I encourage all of you who are concerned about healthcare to read it. It's a recent report done by the California Redwood Coast RISE, which is a state initiative funded, obviously by the state, This research was done by Cal Poly Humboldt, their Center for CC. I'm not sure the two CCs, but it's the Center for Rural Policy. I don't know what the other, I'm sorry.
Yeah, California Center.
California Center for Rural Policy. Thank you. It is an outstanding report. I have, yesterday was able to get the final. This one is the draft report. The only difference between the two is a little bit of language emphasis here and there because there were a number of reviewers. But the data and the conclusions they show are very dramatic. And I think we should all, looking at this, be alarmed and realize how important the work that we're doing here is. In any case, so that's there for you. In addition, Ms. Leach referred to the economic impact of the hospital. And since I am a long-term economic developer, I spent a little time doing my own research on multipliers. And I can tell you that at a minimum, the impact of the hospital on our local economy is well over $100 million a year, well over. I think that's a very, very important for all of us to understand that how critical, obviously, healthcare is and healthcare services are to all of us, but at the same time, we get a huge economic benefit. So it's a good double whammy. And that's all I have to report this evening. Questions? Okay, none? Okay. Then Treasurer Spring, your treasurer's report.
While preparing for the audit, it was discovered that the electronic file cabinet at the bookkeeper's office is not available to us. We need to develop a records retention policy and decide where to keep confidential and non-confidential information. I'm requesting that this agenda be placed on the next, this item be placed on the next agenda. I will work with Rick regarding financial documents. There has been traction in collecting documents for the audit. I had a positive conversation with Adventist Health, and I'm hoping that we will be able to complete the necessary work for the first audit while I am in Sacramento working with Rick Wood. I'm proposing that I go to Sacramento for 3 days to work with Rick so that the expense will be less to the district. So I'm requesting board approval for my travel expenses, which would be hotel, food, and mileage. At the end of this, I will make a motion. I would like to remind my fellow board members that we do not direct each other. We are all equal votes on this board. We need to remember that there are policies and procedures in place, especially when it comes to money. I should not act on direction from a single board member. I should act on action from the full board. No individual member should be emailing me stating, I direct you to. I need to seek clarification from the full board on what your understanding is of the agreement with RGS regarding financial matters. I'm not comfortable with submitting documents to the chair and Ms. Wiley for agendas and having them be filtered, altered, or left out entirely. This is not acceptable practice, or is it standard? My understanding was that they were here to not be involved in this area of the district. Ms. Wiley has not presented the information provided without discussion with me. Ms. Wiley is presenting financial information that I do not have or have not seen, approved of before distribution. Ms. Wiley is speaking on behalf of the district regarding our financial situation is very concerning to me. The document labeled invoices received is not accurate or complete. I have had to contact Ms. Wiley numerous times regarding Measure C funds, and her lack of knowledge or understanding concerning our financial matters could be detrimental to the board. So my action item to begin with is that I'm requesting that the board approve for me to go to Sacramento to work with Rick Wood for 3 nights. Or 4 nights.
Excuse me, Treasurer Spring, but before you do that, could you go through our balance sheet and tell us where our financials? No, I cannot, because the
information was not provided according to the Brown Act, and I'm not willing to have information provided to the board that was not provided to the public at the same time.
I'm sorry, I'm not following. What was not presented?
The bank statements.
Again, I'm not following.
The bank statements were provided to the board prior to being provided to the public, so I'm not willing to discuss them.
Well, I don't get this.
I don't
understand
either.
it.
Okay, so.
It's my
please
choice.
explain.
I'm protecting myself from Brown Act violation
How is it a Brown Act violation?
because they were provided to the board prior to the public.
But so how does your not talking about them protect the public?
I'm just not doing it. Because they should have been provided to the public at the same time as the board.
Director,
The bank statements are part of the board packet, and they were posted online this morning when I posted the rest of the agenda packet. And they are printed in your packet that you have before you.
The board got them before today.
I didn't get them.
well, it appears we have no treasurer's report then. Let's move on.
I made a motion.
Is there a second?
I'll second. The motion was for, Sarah was requesting reimbursement for 3 days in Sacramento to work with Rick Woods. Is that correct?
Yeah, and it would be 3 or 4 nights. It's not determined yet how long I would stay.
Sarah, could you say a little bit more about what you need to do in Sacramento for 3 days?
So this afternoon, right as I arrived here, we received numerous documents from Adventist Health so that we can complete the first year audit. Rick and I need to go through those documents and do the record keeping from our perspective on the first fiscal year that no one has touched.
Were you talking about 21?
Yes.
Okay.
So it'd be July 1st, 2020 to June 30th, 2021. I received a rather large email this evening with documents that had been promised prior, and Adventist Health was able to provide them. So now they need to be worked on.
What about 22, 23?
I'm sorry, I can't hear
What
you.
about 22 and 23?
So 22 and 23 are done through all of the savings bank accounts have been completed through the entire process up to when all the accounts were closed. Those bank statements were provided. 3 Bank of America accounts have been completed through December of 23, and they have been closed. And I'm in the process of receiving those funds from Bank of America. And the Measure C account has been closed.
That's a B of A account? Measure C? I'm sorry.
Measure C is at Tri-Counties.
Okay.
The Measure C account at Tri-Counties has been closed, and the money has been moved to California Bank of Commerce. I'm in the process of opening the class account so that the majority of those funds can be transferred to class to receive the higher interest that the board had already discussed prior. I'm hopeful that the information received today from Adventist Health means that we can complete the first year audit, and hopefully with information that we have for the first 6 months or 7 months of this next year, they can provide us with what we need shortly, and that can be done.
Okay, so 3 days in Sacramento will be spent working on 21 audit?
And hopefully 22 and 23.
Okay. Okay. Just curious, I just needed to know that.
We have been able to
Okay, we have a motion on the floor, or we need a second. Do we have a second? We really shouldn't even be continuing the discussion without it, but.
Susan seconded.
I
Second?
seconded it.
Okay,
Yeah.
second, okay. Further discussion?
Yeah, I got something that I'm really concerned about the way in which Sarah is approaching sharing information, Brown Act. Don't talk to me about the Brown Act. I know enough about the Brown Act now. It's the relationship with us. I feel like I'm being held hostage by the treasurer. I don't get I felt this with the previous treasurer who resigned from the board, unable to figure out what was happening with all these, with all our money. And now we have a hostile relationship between Sarah and our CEO. And the reason that we are so far, that we've spent a year getting very little done is because we've been without a CEO. So we've been haggling over administrative details, which a board is not supposed to do. A board haggles over policy and oversight and planning. And now that we have the opportunity, we're being held up. It feels like that to me. Now, there may be reasons, but in terms of attitude and defensiveness and aggression, this is something that offends me. I don't want to be associated with this kind of offensive behavior. And there's no reason for us to be defensive. The community is counting on us to have a good time doing this, to enjoy this, to enjoy our responsibilities, to trust each other, to not hide behind the Brown Act, and to be forthcoming with our emotions and our feelings, because that's something that enables the community to judge each one of us by, and then in an aggregate, determine whether or not they can trust us as a group. So I'm just making an appeal for some amount of congeniality between and cooperation with our new CEO, who I find to be a hardworking, caring, and concerned person doing our work. This is probably the first time in my life that I've been in a group that I didn't feel good in. When I came into this room today, I had something on my mind, and I was a little nervous about what is on my mind, but I felt a tension in this room, and I didn't know what it was, and now I really feel that tension, and it is not. And if I'm feeling it, you're all feeling it. Everybody feels it. It's not, I'm not so much of an individual that my emotions are different than everybody else's. So enough of the tension. Let's cooperate with each other, Sarah. Period. I'll end with that.
Any other comments from board members? Director Savage?
Okay, I suppose this is a question then, because what's in the packet is a warrant list, and I believe there are some things that we should be approving because there are some outstanding things that are waiting to be paid.
Yeah.
Is that correct?
Well, that may be the case, and we need to discuss that, but right now we should be focusing on the motion before us.
Yeah.
Oh, correct.
Okay?
Okay.
Any more comments on the motion? Okay, I'll call the question.
public.
Okay, sorry.
Mr. McDonald wants to comment.
Well,
And I think there were hands up a minute.
is there, okay. Okay, is there, okay, Mr. McDonald?
Since the discussion has gone this way, I want to say, sort of in response to Director Katzeff, not so much response, but it inspired me. I spent probably a year, maybe more, talking on the phone for hours sometimes with Kathy Wiley, and those were very enjoyable, even though we were talking about harsh things, big mistakes by people. We'll leave it at that for now. On the other hand, if I have to come down on a side on this, in my ever attentive attention, that's redundant, but to process, I think that Director Spring has a valid point here about, she's the treasurer. She'd be putting herself on the line if something is put forth for an action that she doesn't feel comfortable with. I would point out that under the Brown Act, any documents that are distributed to a majority of a legislative body less than 72 hours before a meeting must be distributed to the public at the same time. That may be not exactly what Director Spring's pointing to, but that's kind of the basic language of it. Beginning at the beginning of last year, 2023, Assembly Bill 2647, sponsored by Assembly Member Levine, took effect. This measure clarified that supplementary materials distributed less than 72 hours before a meeting can be posted online, not just in person, if certain requirements are met, and, that's my emphasis, physical copies are made available for public inspection at the beginning of the next regular business day at a public office, so long as the regular business day starts at least 24 hours before that meeting. You guys might want to go back and check that out. And it just goes to, I'm willing to give some leeway that this is the first meeting where Ms. Wiley and this chair have had to collaborate to create an agenda and its supporting materials. So hopefully this doesn't happen a second time, but I think that's where we have to get back to the being in touch with your public. You want to ask them for millions and millions and millions of dollars to build things like what I just asked Ms. Leach about, and you want to cut them off or you want to delay talking to them. And by the way, Ms. Wiley is not the CEO of this organization. I think that Director Katzeff needs to get some of his Brown Act and some of his administrator.
Please, no response. Mr. McDonald, your time is up. Please wrap up your comments.
Agency administrator is what she is.
All right. Any other comments from the public at this point? Okay, so we call the question now.
Okay, Paul Katzeff.
I think I'm
Do you
going
want me to repeat the motion?
I know what the motion is. I'm going to wait. Call somebody else. I'm thinking.
Okay, Susan Savage, yes. Sarah Spring,
Yes.
Lee Finney,
Yes.
Paul Garza,
Abstain.
and Paul Katzeff.
I'll abstain as well.
Okay.
Motion
The result is?
The motion
Well,
passes.
The motion passes.
Okay. Director Spring?
My next motion is to approve the warrant list.
Is that here, is that part of the consent calendar?
No,
Is that on the consent calendar, or is it here?
it's in 3C,
Okay, I'm
3D, I'm
sorry.
sorry. And just to note, I will have page numbers on the packet next time. I haven't quite figured that out in the PDF combined, but I will have those for next time.
Yeah, let me just note to the public who may be thinking about this is that we use 365, and it has a number of awkward kinds of things. One of the key awkwardnesses is that every time you have a Word document, insists on presenting it as a PDF and makes it a little bit difficult to manipulate. We're trying to work through that. We may come up with an alternate system because we want to keep our records clean and neat, and we want to have access to them.
So Chair Garza, there are copies of all the bank statements, and the warrant list is the next item after the bank statements.
I read through it before the meeting, but I'm just trying to find it again. Here we go. Okay, well, I'll look on. Okay. So is there a second to approving the warrant list?
I'll second that.
Okay. Director Finney, any discussion?
Yeah, I have a question about the warrant list. Just January of '24, Adventist Health payment, $1,092,727. I'm just interested, I'm not for or against that, it's just, what is this about? Could somebody explain that $1 million payment to Adventist?
Yeah, Director Savage? Spring?
It's part of the lease agreement that we pay them. It started out as $1 million every 6 months for them to use for leasehold improvements. And it's supposed to change after the 3rd year, I think. The last payment that Jade made was the first year that it was subject to CPI. So for the year, it stays the same, and then it changes again.
So in the lease to Adventist, they pay us $1 million.
No,
Keep going.
they pay us $875,000 in a lease payment that's subject to EBITDA. And
Explain it to the public.
their
please.
EBITDA has not been provided to us till today. I was given the first 2 years of the EBITDA to calculate for myself, and I will do that after this meeting, but it looks to me like it's a negative number, so it will not change their lease payment.
Did anybody,
Director
I plead ignorance of what you just said. I did not follow it.
Can I help?
So let me ask the question again. You referenced a lease payment. So we lease, the board leases the hospital to Adventist.
Correct.
And they pay us, or I would assume, a certain amount of money, $875,000, whatever you said,
2 times a year.
2 times a year. And then what is our obligation? Do we have a specific obligation in the lease for that
Yes.
rent money, basically?
No.
It's not rent.
They pay us a lease payment. We pay them a leasehold improvement contribution.
And that's written into the lease?
Yes.
Okay.
And there are specific calculations of timing of years. I can't remember off the top of my head, but I believe it was 3 years in. Their payment could be affected by their EBITDA, which is earnings before interest, depreciation. We've discussed that. So then ours was set to be calculated also annually based on the CPI index. And so Jade calculated that for the first payment for this fiscal year. I followed suit for the second payment. And then at the next payment, we'll relook at it if it's time to. Because I can't remember the specific, but it's very specific in the lease when the payments are adjusted.
The reason for my question was really to to try and define for myself what our relationship is with Adventist. It's a multifaceted relationship, and part of it is a giant financial piece like this. So I'm trying to understand our relationship and the kind of leverage they have over the district and the leverage that we have over the hospital and Adventist. So I'm just trying to figure out what all this is about. And if I don't understand it, I would assume that the community doesn't either. So that's the reason for my question, was to enable people to figure it out there on the...
Yep. Director Finney.
Director Katzif, the lease agreement is very interesting. I think I've sent it to you
I have it.
a couple times. It is on the website. It is very interesting to read, although it is time-consuming to read. It is long and it is detailed in its legal language, but it contains a lot of our relationships, particularly our financial relationship and the obligations that each of us have to each other. So I would urge you to make it a bedtime reading event, to actually,
See,
that spells it out pretty clearly, if you're interested in
well, I
seeing
think
that.
the important thing is the community might be interested too.
It's on the website.
Yeah,
It's
well,
public document.
now that we've had a little bit of discussion, maybe a few people might actually look at it
I
and
think
know
a
it
lot-
exists.
actually, I think like a
And I
lot of
think we
people
should
have read it.
discuss our relationship with...
Okay.
Director Garza.
Okay, Director Spring.
Do you understand now?
Yeah, I do.
Okay, if you have questions, please just call me and I'm happy to try and help you understand.
I understand. The question, the reason I asked the question is because we haven't had a discussion on this board for a year about the nature of our relationship in a way that the community could understand. It is a very complicated relationship, and we have some very important communication to do with the community. And if people will be asked all at once to try and integrate what we're going to come out to the community to talk about and to engage them, and they don't understand, the relationship financially as well as emotionally, then they don't have a basis for what we're going to bring. So I'm trying to, my questions are generally to help us discuss something that we haven't discussed in 11 months. So.
Vice Chair Katzif, I think you make a very good point, and I think it will be very important. As I talk to people in our community, I find that many of them do not understand the relationship between Adventist Health and ourselves, and so I think you make clearly that's something we all have to work on together. If you'd like, I'd be happy to agendize that for our February meeting.
No, I think we should just take it as pieces of the relationship come up. We should discuss them as they come up. I'm not suggesting them. If you want to, you're the chair. I follow the leader.
I'm just trying to facilitate the communication that, as you're suggesting, that we need with the public. It's a very good point.
Yeah, question.
Okay, Director Savage.
Yeah, I just wanted to know and really appreciate that the bill to Mendocino has been paid. Does that mean that we're current and up to date with them, or is there still
For every
something
invoice
else?
and every statement that I've seen, yes.
Okay, cool. Thank you.
Okay, we still have the warrant list. We have a comment from Linda Williams. Miss Williams?
Yes, can you hear me now? Oh, good. Okay, I just have a couple of comments. I see the invoices for Devaney and RWG Law and those guys, but I don't see the supporting documentation for the items that have been paid, like Pelican and Mendo and so on and so forth, which I know that was a bone of contention with the previous board, and there were a lot of items that were held up because supporting documentation wasn't there. So I'm not sure if I missed it somewhere in the packet.
There's not an invoice for some of these because they're contractual payments. So we don't get an invoice from Christine McGee. We don't get an invoice from Pelican Storage. The Mendo Litho invoice has already been seen. And we don't get an invoice for the other two, the annual bond payment and or the Adventist Health payment.
Okay.
So I agree, I did fail to include the CSDA dues invoice.
Well, it
Okay,
just-
so that's noted. Ms. Williams, go ahead.
Well, no, I was just going to say, I'm only bringing it up because it was a bone of contention a year ago. I'll just say that. And so if we're going to be transparent, I mean, it could be a copy of whatever it is, because I'm sure Pelican Storage has a monthly statement, and so on and so forth. And I could be wrong, but it's just, and I also agree with Director Katza and what he said, and also you, Chair, Garza. I think the statements were very accurate. So thank you.
Okay, thank you for your comments, and hopefully we've clarified things a bit. We still have a motion on the floor. Do we have any more public comments? Mr. McDonald.
I don't want to be up here rebutting Linda over and over, but I think it's important to note that long ago the board established that certain payments are, maybe former Chair Finney or somebody can get the exact phrase right for me, customary and ordinary or vice versa.
Right, yeah.
And that a lot of these payments that Director Spring was saying that we don't receive, and we being the district, don't receive an invoice for, fall under that category. I think only the Mendo Litho, which was already handled previously, probably didn't even need to be on this one. Or I don't know about that, I shouldn't say probably. So that's part of the answer to that, customary and ordinary.
Okay, thank you.
I have one other question.
Director Katza.
This one's sort of interesting to me. Pelican Storage. Now, the first thing that I did was that I was shown when I was appointed by the Board of Supervisors to be on this board was Pelican Storage's room filled with medical equipment. And it had gotten there through, I guess it was used or some kind, it was equipment that was outdated. It was all kinds of stuff. And it would, probably in Uganda, they would love to have it. Now, then there was, in the first meeting that I attended, there was, it was the elephant in the room. All of this equipment that would take a room this size, twice this size, filled every piece of floor space so you couldn't even walk through it. And it was a big discussion about what to do with this. And now it's 12 months later, and something like $7,000 to $10,000 in rent, and the stuff is still there. So I would like to ask, is there anybody responsible for hauling this stuff out and dealing with this? And if there isn't, I would be happy to take that on as a, yes.
Well, yes.
Okay. Director Spring.
I'm working with a company that we may or may not have a contract with to come pick it up. They're researching if we still have a contract with them. There's also the issue that there is possibly dangerous equipment in the room, so we can't go in there.
So, you mean I went in there
Correct.
and I'm still alive? Okay.
Gratefully.
Well, are we going to put an RFP out for this?
There's a company that specializes in it. It's not hospitals have contracts with them to pick up outdated equipment. I can't be a expert, but if you have questions, I'm sure that Judy or somebody would be happy to explain to you how that works.
We have an expert.
Okay, Mr. Johnston.
So, board. So there's many companies that deal in outdated equipment. I think you're speaking of there's possibly some outdated x-ray equipment in there that needs to be disposed of properly. There's a process for that.
Right.
So there's multiple companies. It's possible that the board still has a contract with somebody from the hospital days that could cover that. But if not, I could make some recommendations from our biomedical folks.
Well,
I'm using your recommendation.
Okay, thank you.
if we have a company, why is it taking them 11 months and we still have the stuff there?
It hasn't been 11 months that I knew about that company.
Well, what I'm saying is, aren't we supposed to put out RFPs if there's multiple companies so we get the best deal? Isn't that our responsibility, or is it not part of our responsibility?
Director, I'm sorry, this is not equipment that belongs to Adventist Health. It's equipment that belonged to the hospital district.
Or to the
Yes,
district, to the
yeah.
district, yes, yes. Okay, Director Spring.
My understanding is if we already had a contract with a company, the RFP process would have already have been done.
So when were they let me just ask the question, when were they notified that we had this stuff there?
When was that meeting?
You said you found out about it.
A few months ago, they're looking it up. They're looking it up. I finally found the right person at the company to find out if we have a contract with them. They're back east.
Well, obviously, I'm not satisfied with, I'm just pointing it out. Somebody else has to deal with this. I can't deal with it, but I can bring up the question.
Dr. Miller?
For the peace of mind of the board and the community that's listening, there are pieces of equipment that needs to be disposed of properly, but there is no threat to the community by anything that's in there. At the time when the affiliation occurred and all of this material had to be moved into that storage facility, this district board asked myself and Peter's predecessor to go over there and do an assessment as to whether or not there was anything that was imminently dangerous, and I reviewed what was there and then reviewed that with our radiation safety officer, and it does not pose a threat to anyone who, say, walks in there. Now, obviously, x-ray machines, there are some outdated x-ray machines, and they need to be disposed of properly, because if they were plugged in and activated, they would produce radiation. But that's my recollection of the analysis that we did at that time. That might be helpful.
Yeah, thank you very much. I appreciate those comments. I see that Ms. Williams is wanting to be recognized. The chair recognizes you now.
Thank you. I had been working with Norman a little bit with the items that were in storage. And yes, I agree with the items at Pelican.
Okay.
Norman Duvall, I'm sorry. And yeah, no, not a problem. I was just trying to help him out, and we were going to do an inventory. And it's very labor intensive, especially since we're not familiar with the equipment. But beside the equipment in Pelican Storage, there's a second storage area across the street that has a ton of stuff in it. Most of it is not equipment that was in the hospital. Well, I shouldn't say equipment. It does have desks and chairs and pictures and boards and files that were in there. There were personnel files in there that were not secured. And I'm very familiar with HIPAA. I recognize that those files did not belong over there. And at one point, the hospital was going to take those files and bring them back over to the hospital premises. And of course, I don't know if that happened because Norman's no longer there and stuff like that. But so there is a second rental place, and I don't know what the cost is for that.
Okay, Dr. Miller, please.
So to help allay any fears about patient patient safety, patient privacy and HIPAA. At that same time, when we did that analysis of what was all over there at Pelican Storage, we also went over, I went over there with a team of which included our medical records experts, and we did an exhaustive inventory of all of the files that were in that other place, and I provided that inventory to the board at that time. I believe that it's probably still on my computer and I can provide it again. That inventory was divided into a couple of different categories. One category was medical staff records, and as part of the affiliation agreement, Adventist Health took the responsibility for that, and those medical staff documents were moved to a separate storage area. We did not find any patient records, and we were very concerned. We wanted to make sure there wasn't, and we didn't find any of that. There were a lot of employee records from previous employment, which I would estimate are confidential and need to be protected, but that was the responsibility of the district. And then just boxes and boxes and boxes of old receipts and other things like that. There's probably, I would estimate, probably around 600 maybe or so of the boxes that have, files in them.
Okay. 600?
That would be, as I recall, about, I could be wrong, but I think.
It would fill this room.
Yes, it's a very large storage room, the same size as over at Pelican.
Okay, I appreciate you being here, so it seems that we need your historical memory this evening. Okay, Director Spring.
Lee, correct me if I'm wrong, but we don't have any responsibility or connection to that storage unit anymore. It was given back to Adventist Health because we haven't had anything to do with co-storage in over a year.
Yeah, we haven't been paying them. I know we haven't been paying them. And I was under the impression that those file cabinets are all empty in there now. Maybe Peter Johnson can enlighten
Please,
us.
Mr. Johnston.
So yes,
It's a great
that
mystery here.
storage, there was multiple storage units that were originally belonged to the district. We took over that unit, and we are paying for that storage.
Yeah, right.
However, it still houses a great deal of the board's documents.
Oh, really? There's still documents in there that you would like us to shred.
Okay, I'm going to, at this point, on this particular issue of the status of this, I'm going to ask Ms. Wiley to put that on her high priority to resolve that and come back to us with a report on what we need to do, hopefully no later than next month, maybe sooner if that's possible.
Yeah, and I would say to Dr. Miller's comment, there is not any patient data in there to be compromised.
Well, I'm sure the community is relieved to know that. Thank you. Thank you very much. Okay, we still have the motion on the floor to approve the warrant list. We've had a vigorous discussion. I'd like to, if there are no more comments, I'd like to call for the question now. Seeing no further comments, please read the roll call.
Okay, Susan Savage, yes. Sarah Spring?
Yes.
Lee Finney?
Yes.
Paul Garza?
Yes.
Paul Katzeb?
Yes.
Okay, the motion is approved.
Okay. Before we move on to the next one, I just want to observe as chair that we have not had a profit and loss statement since I've been on the board, and I understand the last one was July of last year. I'm glad to see that we had a balance sheet and a statement of accounts. That's a relief because we haven't always had those. I'm hoping that on our next treasurer's report, we can look forward to having a balance sheet, a statement of accounts, and a profit and loss. Anyway, let's go on to director's reports. I'd like to recognize first Vice Chair Katzeb, who wants to talk about the blue zone, or the blue, not blue. Is that, what do we call that committee, blue zone?
We have multiple names. Actually, I was going to speak during the seismic, you were going to give a seismic report, and I was going to follow that. So could we?
Certainly, absolutely, not a problem.
Thank you.
Okay. Are there any other ad hoc committees that want to, wish to report this evening?
Do you want me to do it? Or do you want
Sure, go ahead.
So Susan and I met regarding the possibility of a board retreat, and we've decided that we will push it out until April or May. Hopefully next month we can talk to you guys about what we've decided so far.
So
what
that's
we're recommending.
So that's your recommendation, correct?
Yes.
Okay, thank you. Okay, appreciate that. Look forward to that. Anything else from directors?
Yes, please.
Director Finney.
Thank you. This is not an ad hoc committee report. This is a personal report that I just want to share with anyone who doesn't already know, because apparently a lot of people look at my Facebook page. So I am going to be moving away to back to the East Coast to be near my daughter in the next few months. As soon as my house is on the market, so whenever that happens, I will be. And between now and then, I will be resigning from the board. But I'm not resigning as of just yet because Sarah had asked me to stay on to help her with some banking transitions that she and I have been working on before recently. So I'm still here for a while, but I will be leaving.
Okay.
So I just wanted everyone to know that.
I appreciate you clarifying that because there have been some comments, but also I'm grateful that you've decided to delay your exit because you have a very valuable memory and knowledge of all things that we've been doing. So it's a great assistance to us. With that, let me turn to our agency administrator for her report.
Thank you. Number one, thank you all. It's been quite a learning curve, as you might imagine, and we've had a few hiccups about posting and all, and I am trying to figure out how to work with all the board members so that we can be as transparent as possible in the board business. I would like to explicitly thank Lee Finney for all the time that she spent with me trying to get me up to speed, and I really couldn't do most of this work yet so far without her help. So thank you, Lee. I really will miss you. Just some quick updates. I have a Zoom account now for the district so that we will have a consistent Zoom meeting number for getting into meetings. I have a focus on the website project to update that and make sure that all policies and any other important public documents are there on the website and easily found. And there is some incorrect or conflicting information that I will be trying to take off or clean up there too. And then I wanted to let you know that RGS is focusing on an interim report, which we hope to bring to the February meeting. That would include initial recommendations about the agency. And I'm happy to answer any questions.
Are there questions for Director Wiley? Yes.
Well, I was just curious, the interim report and initial recommendations, is that the assessment that I think was part of the original proposal from RGS was that they would do a district assessment, and so this is what that would
Through the chair, yes. We had contracted to do the report at the end of 6 months. We're finding some things that need more immediate attention, so we're going to come to you with some initial findings and some possible recommendations.
Okay. Yeah, and for members of the public who are listening, we are in a situation where we definitely need to build the house and make sure that what I would characterize as our infrastructure is in place. And so RGS has been very helpful in helping us to this point to identify some issues, and I'd like to learn more. Look forward to their report. Anything else, Director Wiley?
No.
Okay, Mr. McDonald.
Thank you, Kathy. I think the Zoom, that's progress. that you
Yeah.
mentioned. Regarding, not website, but the district's Facebook page, is it true, sounds like I'm back here with Sean Hogan asking questions that are really statements. Is it true that you have to be invited to get on that page? Because when I first discovered it, I didn't discover it. Somebody else told me about it. And after they told me about it, when I put Mendocino Coast Healthcare District into the search bubble, I still got the old district's thing. And then I believe it was the same person or else another person sort of invited me into the Facebook page. So if that is even partially true, I hope that it's corrected so that it's just open to the public, you know, for comments. And my other question is that, or comment / question, is that I don't know for certain, but it was my impression that the district's former Facebook page, although it hadn't been used since I think 2022, could have been activated if the whatever are the right, you know, passwords, administrative access had just been asked for, and we do still have a carryover member from that board. So I don't know, maybe that member can answer that, or Kathy can answer it. Either way, thank you.
Okay, thank you. I appreciate you drawing to our attention that there's not immediate access to that. I think
I'm not sure exactly what he's talking about. It's a page, and the page person has authority to post information, and then I believe anybody can comment on that, but there's no express.
So there's no need to be friended or something like that.
No,
like
not that I know of.
Okay, let's move on. We'll look into it, Mr. McDonald, and get it resolved.
I don't think I used my 3 minutes.
Well, we have an extraordinary amount of business to look at. Go ahead.
I just want to caution, it only happened once, and it was near the beginning of it. It may have been January, but you know, near the beginning of me seeing it. But there was a post on that Facebook page that was a share from someone who's running for elected office in this county. And that, to me, given that we are a nonpartisan board, and that just putting, you know, I'm not going to say which, but I can tell you privately who it was later.
Okay, appreciate you pointing that out. That's something that we'll watch for. Clearly, well, we don't want to get involved in that. Can we move on now to the consent calendar? Okay, if there's no objection, consent calendar is before you. Can have a motion to approve the consent calendar.
So moved.
Okay, is there a second?
I'll second.
Okay. Any discussion? Board members? Ms. Spring, Director Spring.
So I would appreciate that instead of received by the district, it says who these communications were to, because I don't feel like all of us have had our input of communications we've all received. So I don't want people to assume that that's any and all district communication. And then
I'm sorry, what's the point you're making here?
the point is that emails that I received regarding district business, or that maybe Susan received, I don't see anybody else's emails in the.
Director Finney?
Yeah, well, Kathy asked me to put together the communications list, as I have done in the past, because what I have been doing for some time now, when I was the chair, was since the chair gets a lot of the communicate letters addressed to the board, but not everything, but what's addressed to the chair. So I just, since we hadn't met, or we hadn't done communications since mid-December. There was quite a bit. So I went through them and pulled out the things that from Adventist and some of the letters of complaint that we got. But the actual letters that we got that I have considered as significant communications, because you may recall that one time I was including way too much in communications, so I stopped doing that. But yeah, I did this list. So these are the communications that were sent to me as the chair.
But not to.
Director Savage. Director Savage.
Well, one question that I had, because I believe that we had agreed, because we don't necessarily want to do this.
Right.
That there would be a list that would be
Yeah.
published in the actual documents on the website, is I think what we were going to do before. Is that going to be our continuing practice? Because
Tell me how, I'm sorry, Chair.
yeah. Well, I'm hoping that we go back to what we had agreed we were going to do so that we're not killing too many trees.
Well, I was a little surprised, as you know, with this healthcare report that it was in here. I shared that with you because as I told you, I was a reviewer, so I had privy to it, and I wanted you all to see it. I didn't realize it would end up in our agenda package. So we clearly want to eliminate killing trees. I'm very much in sympathy with you there.
Well,
Okay.
what ongoing practice would be that what would be included in the packet is a list of the communications as we did before, and that any of these documents would be on the website. Is that correct?
Is that?
Yeah.
Yeah.
Director
Just for
Castle.
some clarification, if I get a communication from a citizen wanting to know something or wanting to express something, is that something that I share with the communications department, or and then it's put in? I mean, what is the extent, the broadness of this policy?
Good question.
Because because all of us are accessible to the community, and and there's a lot of communications that aren't actually in print, but they're verbal, and they're important. So what is the scope of this communications policy that we have? Is it limited to just the chairs and just the chair and what is communicated to the chair, or is it spread out more? Is there any policy on this?
It's my belief that these are communications to the district as a whole, but defer to Director Finney.
The practice is, we did not discuss this as an actual policy. It's not written down anyplace, but we agreed some time ago that every agenda should include a communications that was, part of the consent calendar, basically. And so I started doing that. And so that practice has been to keep it to letters mostly of communications from like Adventist or from Devaney or from any of our consultants or our other regular stakeholder types that we get, like from Derek Petrak letters and so forth, that would be of general interest to the board and the public, would be included in communications. So there is not actually a policy that defines what that is beyond what just the practice has been. So that's an open question. The board is certainly welcome to create a policy about it.
Okay, and then what I would invite Director Savage to meet with me, and let's develop a written so that's clear. Okay. Okay, we still have the motion on the floor for approval of consent calendar. Director Spring.
Can we please remove the list of invoices? It's not complete or accurate.
Well, they've already been published. I don't know how we can remove them.
Well, we don't.
They're there, so let's
approve them.
Okay. Mr. McDonald.
Thank you. So if something's already there, you can still pull it or remove it from a consent calendar. That's here nor there, so her motion is reasonable. About communications in general, year ago, maybe even in the prior old board, I might have brought this up, but I know I definitely did sometime long before Mr. Garza was here, so it's not on him. But the city council, I don't know about the board of supervisors, but the city council of Fort Bragg uses an ex parte communication. That could cover anything that's important. You know, Director Katzif is at Harvest Market and somebody talks to him about an agenda item, you know, just he can tell us that, hey, I talked to Joe or Josephine, and that, you know, we know that there may be some little tiny influence from that, or, you know, some company contacted me and they might be a prospective, you know, RFP respondent or things of that sort. That can cover the important things. And I think former Chair Finney made clear several months ago that the communication should be like things that seem of import. And so it's not going to be just every little email between maybe the director of RGS to somebody on the, you know, either Director Savage or Director Garza or something like that. But the more important items, I think that's what Chair Garza was saying a little bit at the beginning also.
Okay, appreciate your suggestion. We'll take a look at the Board of Supervisors policy on that. The motion is still on the floor. Can I call the question now?
What was the motion?
It was to approve
Ready
the
to approve?
consent.
Okay. Sarah Spring,
No.
Lee Finney,
Yes.
Paul Garza,
Yes?
Paul Katzif,
Yes.
Susan Savage, yes.
Okay. Okay, we're now on a regular calendar. Is Miss Garrity in the room?
Yeah, she's online.
Good evening.
Okay.
There she is.
Let me turn that over to you for a progress report on seismic compliance, and following that, I will recognize Vice Chair Katzif for some comments. Okay? Please, Ms. Garrity.
Thank you. I think we have just a short update this evening. The subcommittees have been meeting. The Tuesday ad hoc communications meeting has been discontinued, and we are meeting just once a week with the seismic compliance committee. Ms. Wiley has joined the group. And our update this week is that the survey is out of the field. It's completed, and EMC Research is completing the analysis and plans to share that with the seismic compliant team next week, with the hope of being able to have I believe the intent is to have a special board meeting so we can share results prior to and not have to wait all the way until the regularly scheduled meeting at the end of February. So I believe that's under discussion. Communications, information was taken from the board as well as from legal counsel and been updated. And is ready to, for that just final, we're going to translate the information into Spanish. And in Ms. Wiley's project, the website project, updating of the website, include a page specific to the facilities and the intent to be transparent about the needs for the seismic compliance. That's my update.
Okay, thank you. And I know that all of us are very interested in the results of the polling. And as Ms. Garrity indicated, we will attempt to schedule a special meeting so that, and just take that as a single agenda item so that we can reveal that and have some discussion around it. I think that's, all of you are very concerned about those results. Now, let me recognize Vice Chair Katzif.
Thank you. Well, I want to talk specifically to this bond issue that we're contemplating. First, just some background. When this board came on, when I came on the board in January of last year, there was no commitment to have a bond issue. But this particular board at the time, made a commitment of some kind without voting for a bond issue, or the amount, or what the bond issue would say, or ask the community to support. And at the present time, we still have not had a vote as to whether or not we're going to move forward with a public bond issue to support the hospital's reconfiguration or construction of, in relation to the 2030 deadline for it being seismically safe. So all of this stuff is without a board motion to actually have a bond issue. Now, one of the aspects of a bond issue is what are we selling and what are we asking the community to buy? Now, we haven't been out in the community yet. We don't know what the community wants. We haven't done an assessment of all the assets, healthcare assets in the community. And we are a healthcare district, which means that we are not a hospital district. We have a hospital within our district. But we are responsible for 10,000, the health of the community, 10,000 people in our district. We are responsible for creating a healthcare district with healthy people. And is our community healthy? Well, you have in the report, in the minutes, and in all this
In our
paperwork,
packet.
in our packet, whatever you want to call it, you have a study that was done by the California Center for Rural Policy at Cal Poly, and I have read it. And what it states is that Mendocino, Humboldt, Del Norte, and Lake County are the least healthy counties in California. At the bottom of the county list. We are at those 4 counties are at the bottom. We have a high rate of suicide, a high rate of accidents, a high rate of obesity, a high rate of mental illness, a high rate of drug overdose. I mean, and it goes on and on. And in that context, I just want to read something that the American Psychological Association said about this country. The psychological impacts of collective trauma was their report. From the pandemic, from global conflicts, from racial and racism and injustice, inflation and climate-related disasters, all these things, according to the report titled Stress in America, just 34% of American adults have confidence in the direction the country is going, while about a third of the respondents said they had too much anxiety in their lives to think about the future at all, and nearly half wish they had anyone, who could help them manage a daily barrage of stressors. And that's America. But we're in this country. It's part of our community too. Now, I'm addressing the bond issue, but I'm giving some background of how this bond issue is going to come in, where it's going to lie when it comes in front of a person or our community. What are we bringing this bond issue into? Well, we're bringing it into a very unhealthy community, according to the study. Now, a hospital cannot make a community healthy. It's here for repair when things happen that go beyond health, when something breaks down, when human beings need emergency care, when somebody gets into an automobile accident and breaks a leg, but that doesn't make a healthy community. It just repairs a human being. And that's truly, truly important. But, if I may, say that how important a bond issue is to pass in order for us to have the hospital. And I am a strong proponent of the bond issue passing. But what is the bond issue going to say? What are we going to ask the community to support? Now, does the community know us? Have we been around and attracting more than 12 people on a Zoom? I mean, we're doing the most important work in the community right now, because if we don't have a hospital, we're going to have older people leaving, younger people not wanting to come in. We're going to have problems without the hospital, to say nothing of the $300 million in economic development loss that the hospital brings to us. So we need this hospital to survive. And we need some kind of an initiative. Now, we are coming into a national election. And this is going to be one of the most contentious national elections any of us have ever experienced. The mood is not going to be good. It's not guesswork. So we're in a time right now when we have a national election, which means a thick book, where we are going to be on the last page. And elections tend to, the number of people who vote tend to drop away as the pages go on and on. People get tired of voting, tired of the issues. And we are going to get, this bond issue is going to get lost in this national election with so many other things happening. The country mood is not positive. The local mood, my estimate or my inquiries lead me to believe that this is not a good time to go for a bond issue. The economy here isn't good, and we need some time for this hospital to regain its reputation, which it is slowly doing beautifully. But a year ago, this hospital did not have a great reputation. The community needs some time to love this hospital again. And the people who are in charge of this hospital are doing the best that they possibly can, but there's a limit to how fast a reputation for a hospital that has a lot of anecdotal negativity out there, which can't be denied. So what I'm suggesting is that this is the wrong time for a bond issue to go to a ballot. And now I've been told that you have to have a bond issue on even years. Now, we as a board need to go out into the community and let the community know that there's a group of people who are actually putting their heart and soul into helping the community get healthy, not just saving the hospital, because saving the hospital has a lot of negativity can be brought to that. People can easily say no. We need to inspire the community that we're doing something about better health. Now, I was going to talk about the blue zones, but I just want to talk about a little bit more about health and wellness. The other side of taking care of people who are not healthy. So we need a balance between two. And I would say the hospital is maybe 15% of the wellness of this community. It's community health and wellness is not about repairing everybody in the community. It's about taking care of the people who really need it. But what about the rest of the community? What about mental health? What about, we know all the rest. So I'm going to ask for a motion. I'm going to make a motion that this is not the right time for us to be putting a ballot measure up for a vote. We need more time. this board needs to go out into the community for a year or year and a half with a plan which is based upon what the community has fed back to us and what our analysis is. We need to educate the community so they can have conversations in the home, so they know what the issues are. So when we go to the ballot, we win. We get it. Now, going to the ballot for a second time with a ballot already failed in 2024 is not going to be a good thing either. If we're going to get one shot at it, we should take the shot when we're prepared. And we are not prepared because we have spent 11 months bickering, or to use Linda Williams' term, arguing about procedures and administrative stuff that our new administrator and her team will be doing. So we have more of a chance to do the work that we're supposed to do, which is educate the community, care about the entire community, not just the sick people who come to the hospital for help. They count for a lot, and the hospital counts for a lot, but there's so much more in this community. And that's the idea of a healthy community. Health and wellness is where we should be, how we should be thinking about our role on this board. So I'm going to make a motion that we delay the bond issue till 2026 and have it appear on a ballot by itself, where people can actually focus on it, see it, and where we can have a year and a half to promote health and wellness in this community and get the conversation going.
Okay, well, that's quite...
Sorry to take so long. I just am much better at spontaneous.
I have a point of procedure.
Yes.
Do we need to get a second for the motion before we discuss it?
Yes.
Yes.
Or do you want to have any discussion first before you get a second?
Well, there's a whole lot here, so let's take a moment. I would like, first of all, a response from Ms. Garrity about the issues of elections and whether we could have one of our own ballot, something singly on the ballot. I don't believe that's possible. Ms. Garrity?
Yes, it is. But, if I could, because I would like to speak to some of the things that Paul just suggested, but I don't know if we need a second
I'll
on
second.
the motion.
Well,
Okay,
hold it. Okay, yes, we do need a second on the motion.
Okay, so Sarah just seconded it.
Okay,
Okay,
we have
so
a motion and a second. Let's go to discussion.
Okay.
Director Sepp.
I'm really feeling that the motion that you're making is massively premature because we have money for a poll that's in the field that we want to find out from the voters, one of the measures for what the community feels. And we don't know, because at least I don't know, I haven't heard anything because the poll just came out of the field. What does the poll show? I also have been appealing that we need to get out in the community and do this listening kind of thing that I suggested before. So in addition to the poll, that we also have kind of a thumb to the pulse of what people who are willing to come to a public meeting think their healthcare needs are, so that we have multiple pieces of homework that we've done when we make the decision. Because it could very well be that you're absolutely right, that all of those measures are going to tell us that this is not the time. It could also be that now might be exactly the time. And it is certainly possible to do a special election. It's much more expensive because then we would be paying the cost of the entire election rather than sharing it. But maybe that's part of the calculus to figure out what we need to do to pass it. But we have experts that we've contracted with that know exactly what they're doing, how to help us make that decision. So I'm going to vote against the motion because it's premature. Not that I disagree with the conclusion, because we may get there, but we're not there yet.
Director Finney.
Okay. I echo what Susan has said. I think this is massively premature at this point to make this kind of a decision. I think I've had a lot of political campaign experience, actually, in the Bay Area and in other states, not locally here so much, but some. So I would, and I think our experts will say more about this. 2024 is a presidential election. The turnout at a presidential election is twice the turnout at a midterm election. The higher the turnout, the more likely the bond measure will pass, I believe, is the thinking. So obviously, the more people that vote, even if we're at the end, we would be at the end of any ballot, and the 2026 ballot won't be just us alone. It'll be a midterm election, and there will be much lower turnout because there will be, and we'll still be at the bottom of the ballot. So that won't change. But if we wait to 2026 to make a decision, we're bumping up against 2030 deadline. We need to start construction, pretty fast behind that if we're going to do construction to keep the hospital open. So I think there's some dangers in waiting that long to make the decision, although it may turn out to be that as Susan says, that is wiser. But I would re-echo the other point that was just made, that Robin Garrity said, the poll is now being analyzed, and we should have a special meeting early in February to talk about that and to talk about your concerns at that time, and to start schedule the meetings out in the community. So,
Vice Chair Ketsup, let me just ask this one simple question. Would you be willing to withdraw your motion at this point and have it considered after we have the analysis of the poll presented to us?
I don't have any faith in the poll, regardless of whether you call them experts or not. I saw aspects of the poll. The poll is is worded in a way that I find it to be less than acceptable. So I don't have the faith in the poll, and I'm not willing to take the kind of chances that Susan, that you and Member Finney are willing to take. I think it's too important a job that we have to do, and we have not done the job yet, and we need the time. And yes, you have been calling for let's get out in the community for the last couple of weeks or months, but we haven't gotten out into the community because we just got an administrator to do some of the administrative work that Chair Finney and you were doing. So I'm not willing to take that chance, and there is nothing that says that because there's a greater turnout, there's going to be a greater chance of passing. I think my position is if there's a lower turnout, it's going to be in our favor because the people who we turn out will be overwhelmingly in favor. So
Okay.
am I willing? No, I'm not willing.
Okay. You're clear.
Wait,
I understand. I hear you.
Wait.
It's 2 weeks, but I hear you. Okay.
Let me hear from Sarah,
Let me conduct the meeting, please.
Okay, I was just going to say
please.
that I would
Okay, Director Spring.
consider it if something else came up.
So I think one thing that I'm confused about is I don't feel that the bond not going forward is mutually exclusive from us going to the community. I think that tying those together is probably a mistake, and so they need to be separate discussions. I agree, we need to get into the community. I don't know that us getting into the community or not would mean that we say yes to the bond measure or not. So I think that those need to be two separate avenues, because I agree with Paul that we don't know what this community wants. And the poll that I have is that this thing is not going to pass. So I think he might have a good strategy that we go and get a true picture from the public and more than 250 people. And I agree that the survey did not ask the questions about do they want an urgent care? Do they want a new ER? There was nothing like we talked about in the past about asking them to tell us what they wanted.
Okay, let's go to the public. I see Jenny, Ms. Shattuck, you have your hand up? Chair recognizes Ms. Shattuck.
You can hear me okay? Okay. I kind of agree with all of you in different aspects. I just happened to notice today on my email while I was cleaning out my spam that there was this email from a James Tarkington, I think it is. And it was this survey. And usually if something's like a survey, I usually delete it. But I actually looked at it and realized it was for the hospital district. So I actually had posted on my Facebook, has anyone else received this survey? And no one had. And they said, well, who did it come from? So I sent them a screenshot. And one of those persons that had responded looked in their email and did get something. So I'm wondering, and I don't know if you can talk back and forth, but how many surveys went out? And I'm also thinking like maybe on KOZT in the morning or the city of Fort Bragg on their Facebook or on your guys' Facebook or the different maybe healthcare foundation could put it out there to keep an eye out for this email address, because I wouldn't have known that it came from you guys. I just thought it was some spam questionnaire selling me something. So anyway, I just wanted to put that out there. And the questions were a little odd, but anyway.
Okay, well, thank you. And let me clarify, that was not our survey. We did not do ours by email. So I had nothing.
Wait, there is not a survey regarding the healthcare district and a retrofit that was sent out by email?
No, it was not done by email.
Yes, it was.
Robin.
Okay, Ms. Garrity?
Yes, it was done. The survey was done via phone, email, and texting outreach.
Oh, it was email. Okay, I'm standing corrected. Thank you. Can you shed any more light on the survey at this point?
Well, I believe EMC Research will be able to answer in more detail when they provide their report. But the outreach was to a likely voter universe, those voters who are likely to vote in November, and that includes all of the different demographics so that it's a they say it so much better than I will here, but whatever the percentage of voters 65 and older, that percentage then is needed to get for the polling or certain percentage of men and certain percentage of women. So whatever the anticipated expected voter turnout for November is who they cast their net to. And then as results came in, they will file those in the buckets that they need. And the survey was done through email and texting and by phone. And again, this is their specialty. It's not mine. So I do not feel qualified to answer those questions in detail.
Okay, thank you for your comments. Okay, I don't see any other comments at this point, so we have a motion, a second. Oh, Mr. McDonald, of course.
Is that really necessary?
I'm going to look this up on my phone. I just had it here. Basically, I agree with Director Katzeff. There was some little thing in there that I could be picky about that I didn't, but the general points he was making, you're rushing into something. This survey has things like, here's one of the questions of it: to modernize our local hospital to continue essential services, including life-saving care. I'm going to have to skip some of the words. Life-threatening emergencies, the retrofit, repair and replace leaky roofs, outdated electrical, plumbing, and sterilization systems. Shall the district authorize $20 million in bonds, levying at a tax rate of approximately $27 per $100,000 of assessed valuation? That's you look at the assessed part of your property tax and you'll find that, what that is. I'd like to know where the $27 figure came from. But beyond answering that question, questions like I asked Judy Leach before, can we build an OR or an urgent care? Probably on where Neva Cannon and AJ Gray are. What would be the cost of that? And I'm directly going to ask Peter to look that up, which he probably already made a note about it, or to try to find that out as soon as possible. That's a huge question. The way that part of the survey was, it was like that plus the retrofit, the roofs, the this, the that, it'd be like everything. $20 million isn't going to do that. So, I mean, get real, people. Heed Mr. Katzev. We disagree lots of times and go at each other like dogs and dogs, but he's right. You need to slow your roll. Remember when I pointed out what the statewide Adventist health position was, that they're not retrofitting their hospitals that don't meet 2030 compliance. They're relying on changing the minds in the legislature to push back the 2030 deadline, or to abolish it, for rural hospitals or some portion of those, that Venn diagram of possibilities. And I don't really expect Adventist Health to pay for a new OR here in urgent care. It's going to be on us, the district taxpayers. You guys need to get that under control and decided. Find out from Mr. Johnston or somebody you get from Devaney to tell you what it's going to be per square foot to replace the Neva Cannon and AJ Gray buildings and put in an orthopedic-friendly OR and an urgent care, and then you're going to have to replace where the ambulance crew quarters themselves, et cetera, et cetera. You're way ahead of you've got a cart that is down.
Please reach your conclusion, please.
And the horse is back here, probably back in Elk.
Okay. Okay, any more public comments? Okay, let's call the question.
Okay, so the motion is to delay, and this was moved by Paula and seconded by Sarah, correct?
Delayed to 2026.
Yes, and to call a special election was also part of your motion, not
Well,
just.
no,
Or do you want that in there?
make that
Okay,
part
never
of
mind.
Point of order, you can't have a motion on something that's not on the agenda. You can't act on it.
That's true.
Yeah, that is true.
That is true.
Absolutely true.
Okay.
Okay.
So is the
So
motion out of order then?
It's out of order.
The motion is out of order, but it's not, it's out of order. But that doesn't mean that it's not a good motion. And so I would,
Paul, Director
Director-
Kavitz, we respect your point of view.
Go ahead.
You've raised some very important questions and that we have not fully gotten to at this board, and I appreciate that.
Okay,
And
I'm
I
with
think
you.
you've made an important contribution
Thank you.
to us moving forward.
All right.
Let me suggest that
Go
we will
for it.
have the and I appreciate Mr. McDonald's observation because I was getting lost in this, so that was helpful. So let's, the only thing we can do at this point is let's have a vigorous discussion when we see the poll results, all right? Is
I
that,
withdraw my motion.
okay, thank you. Okay, let's move on now to 5B, which is a critical one that we need to consider. It's the building roof and maintenance on district-owned property on Cypress Drive and River Drive. Do we have someone who's going to introduce that? Director Spring?
To clarify, it's 775 River Drive, not 770. Just so that we have the correct address.
That's the AJ Gray building.
Got it.
So at 775 River Drive, which is the AJ Gray building, I got an email 2 Fridays ago saying that there was a leak and that it needed to be addressed. I got 2 no bids and 1 bid because nobody on the coast except for Redwood Roofers will do prevailing wage. I sent the contract that was proposed for that repair to Mr. Steele. Mr. Steele has reviewed it, gave corrections. I've sent that to Redwood Roofers. They have sent it to their attorney and will send it back when it has been reviewed.
Okay, now, let me understand what you're telling us. The district issued a request for proposal to which you received 3 responses.
You do not have to do an RFP, you just have to contact three companies for doing a public work.
Mr. Steele, you're here, is that correct?
That's correct for the amount that's being discussed, which is about $6,300. It didn't require a formal bidding process.
Okay, this is the total amount is $6,351. So this is not a full redo of both those roofs. Is that correct?
So this is
work calls for a repair.
This is a 2-part issue. So the repair, like he said, currently is at $6,300. I believe Mr. Steele caught something very important in the fact that the way they stated about paying prevailing wage, that if they are not doing it the way that Mr. Steele stipulated, that bid could come back higher. Because I believe that it could have been a loophole. But we have the issue that, from what I've heard, there's a possibility of tearing down the AJ Gray building. So what I wanted to bring forward to discuss tonight is, do we want to pay to re-roof a building that, one, we don't really use the full potential of, or nor lease it out? And if we're going to tear it down in 2, 3, 4 years, you know, if it's $80,000, is that really the best use of public dollars?
Okay, well, this has now become very complex. So let's try and take these one at a time. All right? Director Savage.
Well, I have a question though, because I had understood from some conversation, I don't remember where, that the leak and the problem with the roof was substantial. This wasn't just a couple drips here and there. And perhaps the facilities person might have...
Mr. Johnson, could you confirm that?
This might be something that isn't going to wait for a couple of years for us to decide what the building is, what the fate of the building is, and I don't know if through the chair, could Mr. Johnson talk to what the situation is?
Yes, please. Let me recognize Mr. Johnson to give us he's our facilities, by the way, folks. He's responsible for the facilities at the hospital.
Thank you. So this horrible leak in the AJ Gray building occurred while I was out on vacation. So I first want to thank my staff for helping support all this and thank the board for supporting this. So the AJ Gray building houses the ambulance quarters. It also houses home health. And part of the board actually has that. So it's a very important building.
We're raining on ourselves.
In addition to that, the leak is over the IT server area, which houses our data center for all of the legacy systems, and it's the main point of entry for many of our network cablings come in through there. There's 2 points, but that's one of the main points. So a leak in that building is catastrophic to us. in my understanding and looking at the roof and having you had a roofer look at it as well, that the roof is beyond repair. It's not a fixing roof. It's a replace roof.
But it's also not replacing it.
Please.
Right?
Yeah, so anyway.
Mr. Johnson has the floor. I recognize him at the floor. Let's not have any comments. Let him complete his remarks.
So I would ask the board seriously consider that we need to do something with this roof very soon.
All right, thank you. Very helpful. Thank you.
Question.
Okay. Director Katzoff, I believe you had your hand up first.
Is the roof tarped now? Has that been a consideration? I mean,
No, Director. So the roof has air conditioning equipment on top of it. To tarp over the air conditioning equipment would defeat its usefulness.
Okay. Yeah, thank you. That's real helpful to know. Director Finney.
Well, I was wondering, what is the $6,300 by us? What is that for?
It repairs the leak, hopefully.
Okay, it's not tarping, it's just, it's
No, not
repair-
tarping,
It's repairing
it's
around
pump.
the air conditioning. 'Cause I
It's
get-
pumping the standing water and redoing the area with the material that's there.
Around the air conditioner.
Correct.
But not replacing the entire roof.
Correct.
Just repairing around the air conditioner. Okay,
Correct.
Okay, got it. Thank
Okay.
you.
All right, so it seems to me the first thing we need to consider is the repair on the A.J. Gray building, which may go over the bid of $6,351. Do we have a motion to do that?
I would move that.
Okay.
I'll second it.
Okay, so Director Savage, it would be helpful if you would give us the amount and make that a flexible amount in case the actual cost rises a bit based upon the prevailing wage standards that Mr. Steele has indicated we need to meet.
Well, I don't know if what you want is a top end. Is that what you're suggesting?
Well-
That we authorize up to?
Up to, yes.
what's the RFP
Well,
beginning?
the estimate there preliminarily
Preliminary.
is 6,300.
I would say, just say
Yeah.
6,400 because it's 63 something and.
Well, and I'm not sure if, how much more we need. I mean, my thought would be in the vicinity of 8,000. So up to, but
Okay,
not
so
to
your motion
exceed
is to
8,000
approve
without
up
a
to
subsequent-
8,000 without,
Sure.
Okay.
And with the hope that it's closer to 6,300, but I think personally to protect that building, because we don't know for sure what the future's going to be. And it could very well be that in a couple of years, we're going to demolish it, but I think it would be helpful
Okay.
to have that option.
okay, so we have a motion on the floor. Is there a second?
Yes, I second it.
Okay. Now, if we can go to questions, I'm trying to follow the way we should be doing this, but it's been very difficult. But let's see if are there questions that board members have before we go to public comment? Questions only, not statements of position. Okay. Director Spring.
So there is a question of whose responsibility it is to fix any of these roofs. So I have asked Mr. Steele to review the lease regarding these leasehold improvements and whose responsibility it is and whose money would be used to do either or repair or replacement.
Okay, that's not really a question, but okay, that's good information, so.
Yes, it is.
Is there
Just put a who on the
Okay.
beginning of it.
Okay, Director Katzoff, you have a question?
No, I would like to restate what Sarah said and just say, who is responsible? That is the question.
Okay, fine. Mr. Steele, you've looked at our lease agreement. Do you have a sense of that at this point?
I have not had time yet to do that research, Mr. President, Mr. Chairman, so I'll have to do that and report back.
Okay, thank you. Okay, questions? Questions?
No,
Okay.
statement.
Okay, any public comments? Mr. McDonald?
Is it not true that expenditures up to $10,000 can be made or approved by the board treasurer?
Or
And
chair.
treasurer and/or chair, I believe.
The chair.
If Director Savage is amenable to raising the limit to like 10,000 or 9,999 to make a little more flexibility, that's a possibility. Thank you.
Okay, Director Savage?
Well, that would be very acceptable, because actually I had 10,000 in mind, but I didn't want to shock anybody with that. But the other contingency,
Okay, are you
I don't
accepting,
know.
are
Hang
you
on,
accepting
I'm
the suggestion of a friendly amendment?
I am, however, I may want to suggest that we amend my motion further pending determination from our attorney as to who is legally responsible for that. And I mean, it seems pretty clear that we are, from what I know. However, if it's the will of the board that Mr. Steele take a look at that lease and make sure that that is in fact the case, I could include that in my motion as well.
So please now state your motion.
The motion is to approve up to $10,000 to repair the roof on the A.J. Gray building, pending determination from the attorney that we are in fact liable for that repair, which should happen, I'm hoping, as quickly as he can get to it.
Okay, and then the second was from Director Finney. Do you accept
Yeah,
that as,
I'll accept that.
accept that as a friendly amendment?
Can I make a recommendation? Please?
Yes.
Or just give you a point to consider? I mean, we have testimony tonight from the tenant, a representative of the tenant, about the potential damage. I would not make the repair, I recommend that you not make the repair pending a determination, because I would have to come back to the board would have to make a decision, and there could be quite a delay. If the tenant is responsible for it, we'll figure out a way to get reimbursed this initial amount. And that way we won't be in danger of causing further damage to whatever's inside that building.
Excellent. So,
Thank you. Hold it.
if I could go back then to my original motion, which was to approve up to $10,000 to, as quickly as possible, repair the roof on the building.
Okay, and you accept that?
Yes, I do.
Okay, so that's the motion on the floor. Are there any other public comments, okay, from the audience? I see, no, that's a thumb
just
up.
a thumb,
All right.
yeah.
Okay, then.
Oh, wait,
Now it's back to the board for further discussion. Any more comments from board members before we vote? Director Finney.
Yeah, I think it's important that we have the attorney review the release for this purpose as well as other purposes. But particularly for the A.J. Gray building, since it is the one building on the campus that sort of belongs to the board, and the board uses the majority of the space there was designated as our space until we agreed to move the ambulance folks in there. Still, I'm pretty sure that we're responsible for the A.J. Gray building. The other, not so sure, but certainly the A.J. Gray building is probably going to turn up. I would guess is going to come. Mr. Steele will find that is our responsibility. So, and the fact that the IT equipment is in jeopardy means that we really need to do this now. So yes, I would support moving it as fast as possible.
Okay, any more comments at this point? Okay, thank you. Call the roll, please.
Okay, Sarah Spring,
Yes.
Lee Finney,
Yes,
Paul Garza,
Yes?
Paul Katza,
Yes.
Susan Savage, yes.
okay.
Motion
Okay.
is approved.
Okay, now, let's go on to the, and you know, I'm going to chide the board members a little bit, because this was, we were asked to put this on the agenda, but this has become a very difficult process. In the future, if we're going to ask for items on the agenda, we need to have it with a written report and a statement of what kind of recommendation is going to be made. This is a very, very difficult process to go through. All right, so let's all agree that we are now going to communicate, and we're also communicating with the public. If I'm confused, how do they know what we're talking about? We need to have these kinds of things in writing. So as I understand it now, we're now, that's the A.J. Gray building. Now we move on to the issue of 5116 Cypress Drive, is that correct?
Correct.
Okay.
So we've been asked to get quotes to replace the roof there, there's multiple questions. One, whose responsibility is to pay for it? And two, I was told by the head of Public Works of the city of Fort Bragg that it would be in the best interest of the district to remove the skylights. Because skylights, especially the ones with the plastic domes, need maintenance and or replacement or repair every 10 years. And now with Public Works projects, it's not recommended to leave those types of skylights in a public building. So there's multiple layers to, do we leave the skylights? Do we change the skylight to a glass skylight? Or do we get rid of skylights?
Okay, and how does that affect our decision about performing the maintenance that's apparently required on the?
I'm sorry, I can't hear you.
So how does that affect our decision in terms of moving forward on deliberating on whether we repair the roof or not?
Well, one, we need to decide, is it our responsibility to pay for this?
Director Katzen.
When it comes to rain and water damage, we can fight the battle over who pays for it later. It is wintertime. And as somebody said, we can figure it out later, but let's keep the place dry. That's the important thing. If we have a mission, let us make decisions that fulfill the mission.
Okay.
If we have to pay for it, if we're the agency right now that has the money to do it, let's do it, keep the place dry, and then if it is not our responsibility, but Adventists will come after them, and they're here in the room, they hear the discussion, and they're on our side. They're on the side of dryness, all right?
Okay.
So we have to be on the side of dryness. So let's go for it. Let us do what we're supposed to do. Let's do the responsible thing so no more damage gets done.
So do you have a motion that we go forward then?
My motion is that we go forward regardless of who is responsible, and if we are not responsible, I don't want to lengthen this thing. My motion is that we go forward with paying for this and getting it done.
Okay, is there a second?
I'll second.
Okay. Okay, let me have questions. Any more questions from the board at this point?
I have a question. I don't have the backup about I don't have the actual contract, so I wasn't able to include it.
Yeah, and well, that's something that we're going to have to work through, clearly. But right now, I think we're just trying to make the decision about whether we're going to go forward. And the next question is going to be, seems to me that was an RFP issued, and were there any responses to that RFP? But that's another thing. Okay, we're open for public comment on this. Mr. McDonald.
Thank you. I agree with Director Garza's statement a few minutes ago that in the future, I mean, it'd be nice to have everything in writing. Some other members here could remember me asking for $1 million transfers, having some supporting documents a year ago, or approximately a year ago. Also, I agree with, doing this. I agree with Director Katzev. I think one of the things, along the lines of what Chair Garza was pointing out, it would be helpful. Oh, quick preview, backup, excuse for, this was discussed at the Measure C committee on Monday afternoon. That's the reason why things are not, perfectly reported here, with backup in writing. So there's two sides to that. But in overall, Director Garza's point is valid. In future, I think that instead of just saying recommended action, when things are supplied to the chair and the agency administrator in timely fashion, the motion, a description of the item which sort of inherently has a potential motion in it is what's really helpful. If you look at supervisors, city councils, Kathy and I discussed this in December, but a million things have happened since then, but that would be my recommendation.
Okay, thank you. I appreciate your comments very much. Okay, any other comments? Okay, we have now any further, Director Finney?
Do we have a bid other than the single bid from Redwood Roofers for the Cypress building?
I have a no bid and a bid from somebody that refuses to do prevailing wage.
So the same prevailing wage requirement exists for both buildings, right?
Correct.
And the Cypress one is how urgent is that?
Urgent. But we have, actually, I misspoke, so let me clarify before we do. We have 2 no bids and a bid that they refuse to bid at prevailing wage. So basically, it's a no bid.
So the only bid that we have is the one that Adventist got from Redwood Roofers.
I got a newer one because it was out of date.
Oh, okay. Is it the same amount?
And how did we, I'm very concerned about this because we're going to exceed the limits of emergencies and all that. How did we receive those bids? Did we do an RFP process?
So I talked to the head of Public Works for the city of Fort Bragg, and they said that the requirement is 3 bids. I called 4 people.
I'm sorry, what was that?
I'll call
It's
you.
for the, it's for here.
Hospital.
Oh, okay.
Okay, point of information, because our facilities person has been waving his hand.
Yeah,
Could we possibly?
Peter.
Just a little clarification. So that's the Founders Building at 516, 515 Cypress. That is a shake shingle roof that is beyond its life. It's currently not even walkable or repairable. The skylight question, I'm glad you asked that question. If you've been in that building, without the skylights, that building will be a black hole. We could certainly add some lighting to help there, but the skylights would be replaced as part of that project, I believe, with the newer version that would not be a
No, he did it numerous ways.
numerous ways.
Yeah, he did it with, is it okay, Chair Garza, that I answer that question?
Please, yeah, please. No, this is the point.
He did it
you.
with skylights in the same style that they are now. He
Yes.
did it with glass skylights, and then he did it with no skylights.
Very good.
So that ways we could have the discussion of what would be the best fit for long-term.
Well, thank you, board, for going that extra mile, because that's a great discussion to have. So we could certainly make that work either way you decide.
So I thought I remembered you saying that it would be a black hole.
Yeah.
So that's why I asked for the glass quote.
Okay, very good.
Okay.
Is there something better about the glass? Can I ask?
As long as they're serviceable. And I just wanted to share what building that was and that it's a shake shingle roof, which is important.
Okay.
And Director Garza, I believe you asked how urgent this was?
That's one of my questions, yes, how urgent is
You
it?
can see light from the attic.
Okay.
Okay.
So it's very pressing. So we need to move on this, and I certainly believe that let me say, I wish we had have done this earlier. I think I feel a little bit badly that it's gone on this long. The question I have for Mr. Steele is, we apparently secured some bids. What kind of a process are we required to do to make sure that we meet the all the government code that over procurement?
Well, this is the first time I'm hearing about the second one. I've only reviewed the contract for the first one. Is the second contract in excess of $25,000?
Yes.
Yeah, I believe it's somewhere in the nature of around $90,000. I'm not sure.
99,325.
Yeah, so the health and safety code requires a bidding process for contracts over over $25,000 or over a different process for over $50,000. I was comfortable with the first contract because that's below all of those thresholds. Though The only exception to that is for a situation where the board finds that there's an emergency. And that would require, to be part of your motion. So if you're considering going forward with only the one bid, and you've heard facts from the hospital, as I understood it, to indicate that there may be truly an emergency situation in terms of the roof just being done, I would recommend that the board make that finding. If you want to have staff go through a bidding process, then that finding, you could just authorize the process, and that finding would not need to be made.
Okay, thank you. Thank you, that's very helpful. Director Savage.
Yeah, just point of information, can you clarify the requirements in terms of prevailing wage? Because am I right that was one of the problems with the bid?
This was made with prevailing wage, the one that, the one that Kathy quoted the price.
Correct. So what are our requirements in terms of?
We're required to require our contractors to pay a prevailing wage.
Got it.
Okay. Director Spring.
Just for a point of information, I have clarified through 3 building contractors and 3 roofers, there is only 1 roofer on the coast that will agree to do a prevailing wage job. None of the rest of them hold the insurance or bonds to do public work projects.
And my concern is that we have a transparent process, and it could be that, and while I would prefer it to go to a local contractor because we're concerned about our community, I also want to make sure that we're following the process that we're required to, so that there's no question that we haven't done anything, a backhanded deal. So, but given that, if Director Savage is willing to again amend her motion, I think
it was Paul Katzif.
Oh, I'm sorry, Director Katzif.
Yeah, I want to amend the motion to say that this is an emergency.
Okay, and we have
Include that as part of the motion.
Okay, wait just a second, Ms. Wiley. Okay, and the second was from Director. Do you accept that?
Mm-hmm.
Okay, fine. So that's the motion. Ms. Wiley.
Thank you. So the total bid was $99,325, and I think the board would have to decide the 2 skylight options. One of them is $17,350, and that includes skylights extending to the curb, clear acrylic, and then skylights, thermal skylight unit at a cost of $21,050.
That's in addition to the $99,000.
That's, I think, what I'm reading here. It's the first time I'm reading it, so I think that's correct.
Before we go any further, Mr. Johnson, do you have a recommendation?
About skylights.
Please. None of us are experts on facilities.
My recommendation is we maintain the skylights. That is a very nice building. Removing the skylights will make it a black hole. One more thing. There's the folks that occupy that building right now definitely could use the light. So it's definitely important to maintain that natural light.
Okay, thank you. Thank you. It's important to have someone who has a knowledge of facilities. Okay, Director.
So the contractor said that the glass is easier to maintain on the coast because the acrylic is brittle, and especially with the proximity of the building to the ocean, that they do start to have problems after 10 years.
Okay, that makes a great deal of sense. Mr. Johnson.
The skylines aren't what's leaking.
No, but
the skylights are not what's leaking. The roof is leaking. The shake shingles are leaking. So.
Right.
But noted.
Right.
Okay. Thank you. So, given that, what is our expected cost, Ms. Wiley?
I didn't total them. It's going to be $99,325 plus $17,350 or $21,050.
So 21,000 is the glass.
Yes.
Yes, thermal skylight unit, tempered over laminate glass.
Yeah.
Okay.
Chair, can I suggest that as part of that motion, you authorize the board authorized a 10% contingency. These kind of projects often have unexpected change orders, and you would not want to get in the middle of a roofing project and have to come back for that. That would just be a contingency amount, just in case.
Thank you for that very, very sage advice. Yes, I appreciate it very much.
And that's the maximum amount that would be allowed by the Public Contracts Code.
Okay.
So that would make it,
So let's read our Director Katz's amendment, our motion, please.
I'm not sure I can.
Well, let's start. It's to authorize the repair of the roof. And as I understand it at this point, it would include the thermal glass, right, which seems to be appears to be the better option. And then the third thing is we would be approving a contingency amount of 10% in the event of any change orders. Is that accept?
And it has to have, we're doing this on because it's an emergency.
Okay, and then this is we're taking this action because this is an emergency. All right. And I think any reasonable person would see that we're up against the wall. We need to get this fixed. Okay. Director Savage, do you agree with the
Yes.
that?
Yes.
Okay. Given that, can we move now to roll call? Have we discussed this further? Okay.
Roll
Okay,
call.
let's go.
Okay, Lee Finney,
Yes.
Paul Garza,
Yes.
Paul Katzeth,
Yes.
Susan Savage, yes. Sarah Spring.
Yes.
Okay,
Motion
wonderful.
passes.
Thank you. Okay, Mr. Hurst, Mr.
Would you like to entertain a break before we go to executive session?
I'm sorry.
For 3 hours. I don't know how you guys are doing it.
It's fun.
I don't know what your custom is, but if I was
Well-
sitting in the chair, I would have taken a break.
Well, I appreciate that, and I don't know what our custom is either, but whatever it is, I'm trying to change it very hard. So please, I recognize you for a report on Measure C, and we very much appreciate you being here and apologize that you've had to wait so long.
Hey,
Could you have a 5-minute after Jim's break?
Or a 5-minute before gym break?
All right, since you've raised it, if there's no objection, Mr. Hurd,
I have no objection.
okay, Chair authorizes a 5-minute break.
Wonderful. Thank you.
Conversations, and I apologize, but I think we need to get moving
We
again.
need a board member. Where'd you go?
And I appreciate the recommendation from Mr. Hurst to get us a break. So I don't know where Director Spring is, but let's go ahead and hopefully she'll join us soon.
You want to begin?
Yes, please.
It's been about 11 months since I was here before you, and we have not had a Measure C committee meeting in that time until January 22nd. And the reason we did not have a committee meeting was because there wasn't a committee. I was the only member. So during that period of time, no funds were approved to be spent out of the Measure C balance, and that fund is continuing to grow. And tonight, I'm happy to tell you that we will be releasing or have approved and agreed for some expenditures. You have my written report, but I want to go through it with you because I have some side comments and editorial comments that I feel are appropriate, particularly after sitting here for 3 hours and listening to you deliberate on some of these very difficult issues that you're dealing with. The first item on the agenda for the meeting on the 22nd, and we have 3 members now. Gabriel Maroney is here, and Dr. Diane Harris is also there. We have 2 vacancies, which I encourage you to fill as quickly as possible. It's much easier, frankly, I'd prefer the original 7 members, because when you had 7 members, you had a much broader input from the community in terms of feedback as to parcel C tax money being used. I was the co-chair of that committee, and we went through a lot of the questions that you were raising tonight and that Paul was raising tonight in terms of the appropriate timing of the election, how you win such an election. And there is a methodology to that, and it's very important to take your time. So please give me 2 more members as soon as you can. My term
So
is
noted.
2 more years, and I expect to be able to fulfill that term and hopefully be around after that. But we need 2 more members. Sarah reported, as the treasurer of the district, that the Measure C account balance is now $3,803,437. This included a true-up payment on December 23rd. Measure C money comes 3 times a year, and it's roughly $1.6 million, $1.7 million net, depending on the exemptions that are made each year. And those payments come in March, August, and December. And historically, they have not varied more than 10% during each one of those periods since 2019. So my first response to Sarah was, well, that's really great that there's $3.8 million, but there's some more that needs to be added to that fund. And later in my report tonight, I will specifically suggest to you what that amount is and why it may not be there. Sarah and I agreed to meet and review the fund balance for approval at the next meeting of Measure C, which will be on February 5th. My comments later in this report will talk about what Sarah and I will be meeting and talking about and trying to find agreement and support so that you as a district board can add the additional money to the Measure C special reserve account, which has now been moved to
California Bank of
California
Commerce.
Bank at an interest rate of 5.5%.
5%, and we're moving it to class where we'll get 5%, 5.5.
So this is pretty major on $3 or $4 million. And in the past, that account has been drawing very little interest, zero. So we need to move in that direction. The good news, the Measure C committee approved the requested allocation from the foundation of $230,000 for the purchase of an ambulance. This is consistent with Measure C past expenditures. In the 22 decision allocation, we authorized $260,000 for an ambulance at that time. And in the revision of that $2.2 million allocation that Adventist Health requested, the ambulance came out at about $180,000, something like that. So you're in the ballpark, and the Measure C committee has said from Measure C funds, you may use $230,036.18 for the purchase of that ambulance. That's just the basic vehicle and the minimal upfitting, I guess is the right term, that they do before they put in the very special equipment. The ambulance will actually cost considerably more than that by the time it's ready to go into service. The second part of the good news is that Measure C also approved $100,000 for roof repairs at the district-owned medical office building at 516 Cypress. Again, Measure C criteria includes roof repairs that you're responsible for. In 2022, when we approved the $2.25 million, $935,000 of that was earmarked for roof repairs at various locations in the hospital. When the reallocation was done, that amount of money was for roof repairs was changed to $375,000. And give you a cross comparison at the end of my report tonight of what's actually been spent out of that $2.25 million. The Adventist Health made a very concise report on November 1, 2023 of how that $2,225,000 had been spent. The Measure C quarterly meetings are now scheduled for 1 p.m. on April 13th and 1 p.m. on September 16th, 2024. A November or December meeting will be scheduled for later. The ordinance requires quarterly meetings and other meetings as needed. But we try to establish a calendar so everybody knows we're going to get together, so that Adventist Health knows that they got to get their requests to you. You've got to take your actions and bring it to the Measure C committee so that we can keep these wheels turning. It was further agreed that the 23 annual report, which was not made because we hadn't had any expenditures, didn't have anything to report at that time, would be incorporated with the 2024 report, which is due in July or August. The statute requires a report by the Measure C committee of how the money has been, what money has been received and what money has been expended within 60 days of the close of the fiscal year.
Oh, okay.
So that'll be our report. My last report was in July of 22. Okay, now we get into the more difficult issues. The Measure C fund balance, what should it be? It's really not complicated if you think about it in terms of you have a money stream coming in 3 times a year, and that's approximately $1.6 million, $1.7 million every year, 2019, 2020, 21, 22, 23, and now we're into the 24 cycle. So you can verify that money, and it should have been deposited in the Measure C account. Unfortunately, it wasn't always. And the reason why there was confusion of where that money was deposited is because the county gives you one check. And that check is labeled property taxes, other incomes that are related to it, very minor, and Measure C, which is the big part. And the previous board, not this board, put the money all in the property tax account. And except when Measure C committee would holler, the money wouldn't be transferred properly to the Measure C account. On January 23rd, there was agreement between this board and the Measure C committee that the amount of funds available, using the simple way I described, money in, money out, money that had been approved, that the amount of money in the account should be $3,215,196. And that's documented, and I have spreadsheets which you've had in the past I can give you again, and Sarah and I will be going through this in detail. I didn't want to bring that tonight to try and go through it, because that's what Sarah and I and Kathy will work on. But this board said, yes, that money that should be available, that should be in that account, was $3,215,000. However, the account only had $1,464,000. So there's a huge gap. I gave a report to you and recommended that you transfer $1,700,000, and I supported that to you, and you took action to transfer $1,500,000 to that account. I'll give you the exact. Do you have a date?
February 23.
February 23.
You transferred on in February $1,562,562.65. And I'm guessing, I wasn't privileged to the determination of that amount, and why my recommended $1,700,000 was not done is because you probably took, Jade was the treasurer at that point, Jade Trippett, and he probably took the amount of money that had been received in the year, the net amount of money, and you as a board decided that's a reasonable amount to move in, because we know. What's that feedback?
It's the hospital. It's the hospital.
Oh, okay.
It wasn't inside your head.
So that would be a logical decision to make. You know, we have received $1,500,000 from the county. It's set in the property tax fund. Let's put it in the Measure C fund. However, from the Measure C committee perspective, that left a difference of $188,000 of what we had determined at the time had been the total amount of money received less the amount of money approved for expenditures. So that's a task that Sarah and I have to figure out. I'm very confident that calculation that the 3.215 million was accurate. And I recommended at the time that $188,000 be added. It was not done. So I took a look at what's, I think, happened in 2023. And I would officially request that I receive copies of every statement from the county that you receive when you get money, so that I have accurate numbers to report in the Measure C committee. I have some that I've attained myself, which I'll be happy to share with Sarah. Jade obtained a few, but we don't have them all. But using this history, going back to 2019, I would expect that in 2023, the district received in March $600,000, in August $110,000, December $865,000, totaling net after exemptions, fees for the county to collect the money, your contract with what's the name of the company? East Shore. Your contract with East Shore, all the expenses associated with that there'd be $1,575,000. If you take my $3,200,000, which you had agreed to, and add $1,575,000, the money in the account at this point in time should be $4,790,000 that you have to decide how to spend on Measure C qualified projects, roofs, ambulances, and your own particular projects to improve the health care of our community. So the restricted fund balance that Sarah reported on 123 of $3,803,437, according to what Sarah told me, included the December payment. So we need to bring the Measure C committee up to that current balance, which would require $986,000. And again, I'm giving this out to you, but Sarah and I will do the homework to prove me wrong or prove me right or come somewhere in between. But the difference of $986,000 is made up of the $188,000 from 2023 and the $798,000 from 23 that has not been yet deposited. So that's where the Measure C committee will be discussing on February 5th and attempting to resolve. A further part of the report, which I have not given you copies, I just want to comment, and I will give you this. I did send it to Kathy and Sarah, but in November 1, 2023, Adventist Health gave you a very good spreadsheet of the Measure C approved allocations where they had spent. If I can just go back a minute, the Measure C committee had approved the $2.25 million, and Adventist Health, after 6 months, said, hey, no, we want to spend that on different projects. And you came back and we reallocated those funds, different priorities, different needs, and the district board agreed. So Adventist Health in November provided a spreadsheet which showed what had been spent under their $4 million of improvements and what had been spent under the Measure C budget improvements. So I thought, well, why not take a look at that and put them side by side and see what's been spent where and what the total projects have been done. So I did that on your, So that you can see that this money came from the Measure C, this portion came from the $2 million that you annually give to them. It's confusing because there are Measure C projects in both lists. So those have to be added together. But again, I provided Sarah and Kathy with that information. That pretty much concludes my report. I'd be happy to answer any questions, and I'm looking forward to the next year and getting this all back on track.
I appreciate it very much, and I very much would thank you for your assiduous work on behalf of our community and your excellent presentation to the board. Are there questions from board members? Questions now at this point, please. Okay, comments from the public? Miss Leach, what a delight.
I want to thank both the district and Measure C for the conscientiousness of this project and the process that we go through. We never take a single dollar of this for granted, but we know how essential it is to keep healthcare local. And all of this is maintenance. And so in the reports that we submitted back in November, we showed the detailing of it. Thank you so much for putting it in this format for us. We also showed that there was an additional $7 million in repairs that Peter and his team have identified that needed to be done. So my comment to you today is, first of all, thank you for that, and thank you for continuing to think about how do we make sure that the funding, of which is an additional $7 million, you all have that report that we submitted, can be used to make sure that healthcare remains local. Thank you.
Okay, thank you. Seeing no more comments, okay. Okay, Mr. No?
Oh, no,
No, we're
sorry,
at
I
public
thought there was
comments
no
now.
more
We'll come
comments.
back to the board.
Thank you, Caddy.
One of you has to grow or one of you has to shrink.
Marshall.
Needed bonds. Yeah.
Even though Jim is far younger than my great-grandfather who came here in the gold rush era, I broke that up for you. It's just something about the way he speaks is so believable, just the tone. But I've been to Measure C meetings since the beginning and then had hiatuses of coming, but looking at all the things. And I know his work in the Noyo Harbor District, he is just a devoted individual to what he does. And the keeping track of the money is so impressive. This probably wasn't Jim, but on what's in the packet, it says the next meeting is April 13th. I believe it's the 22nd. Maybe Director Spring or Gabriel. Thank you. Yeah, I believe it is.
You're right, I made a mistake.
Oh, well, it was that one at 84, but.
Okay, any more public comments? Okay, seeing none. Director Spring.
I'd like to make a motion to accept Measure C's recommendation to purchase the ambulance for $230,036.18 and to release the $100,000 for roof repairs.
Okay, is there a second? Now, I know that I'm a little bit newer than many of you. I thought that Measure C folks actually direct us to do this. We have to approve it.
You have sole authority to decide how that money is used.
They recommend.
Okay, they recommend. Okay. I thought as being an independent committee.
Evaluates and says, yes, this will pass muster. You guys have to take it. We have no authority.
Okay, it's been moved and seconded. Is there any comment at this point? Seeing none, let's call the roll.
Okay, Paul Garza,
Yes.
Paul Katza,
Yes.
Susan Savage, yes. Sarah Spring,
Yes.
Lee Finney,
Yes.
Okay, thank you. That's moved on. Let's move on to item 5D. This is the board resolution, I understand is necessary to change signatures on accounts. Director Wiley, Agency Administrator Wiley, would you present this, please?
Sure. Yeah, let me get there. Just a sec. This is a required resolution. It would be the first one this year, and it establishes signatories for the new bank, California Bank of Commerce, for 1, 2, 3, 4, 5 operating accounts. And the board signers would be the district officer, the board signers should be the chair, the secretary, and the treasurer. And there are disbursement or withdrawals of district funds in excess of $10,000 that require at least 2 signatures of the officers or directors identified in the resolution. And we have to do wet signatures, and they have to be sent to the bank.
Okay. Okay, is there a motion to approve this?
I move to approve this resolution 2024-1.
Okay, thank you. Second?
Second, Lee.
Okay, I think Director Finney seconded. I know it was a close run there. Okay, is there any comments at this point?
Nope.
Okay, seeing none, let's call the question.
Okay, Paul Katza,
Yes.
Susan Savage, yes. Sarah Spring,
Yes.
Lee Finney.
Yes.
Paul Garza,
Yes?
motion is approved,
Okay, great.
or resolution.
Resolution.
Okay, so let's go on now to 5B and again, 5E, excuse me, and I'd again like to ask Ms. Wiley to introduce that, and at the same time, I'm going to pass out the version provided to us just today by our attorney, Craig Steele,
Those aren't what's in here.
with some minor changes to what was published in the document, and the agenda, excuse me.
Yeah, so the agenda was actually sent to printer this morning, and we got this document approved by Craig an hour later, so that's in your packet now. And the purpose of the policy is to establish retention and disposal of district records. And I think you've all had there were some minor wordsmithing from Craig, but I think the initial document is fairly representative. There were minor wordsmithing. You will note that there are some records that are exempt from records retention, and those are noted. And there is language about confidentiality and contractual requirements, and then definitions of what the records are.
Okay, and as I understand it, this meets all the government code requirements.
Yeah, and I believe it is essential for audit purposes.
Yes. Yeah,
Okay.
it would be. Thank you.
Questions? So that was going to be my question in terms of the timeliness. Is there a reason why, since we just got this, that it needs to get approved tonight? Or can this be considered a first reading to be approved at a subsequent meeting?
That should be at the direction of the chair, I would think. I know that it is.
Well, I just didn't know if there's something looming on the horizon that this has to be passed immediately, or can it be considered a first reading to keep it a little cleaner, neater?
I don't know that there is anything looming. It's just nothing is in place at the moment, and it's something
nothing has been in place for over a year.
Yeah. Yes.
That would almost qualify as an emergency in and of itself, but okay. Okay, so your concern is that you want more time to consider this?
Yes.
All right,
Yes.
all right.
My
Are there other comments?
My other question is, it does refer to a district manager, and I don't know who that is.
Well, I think, as you know, and we've had a little bit of confusion because posted bylaws refer to a district manager. I understand now that we have changed that in the updated to executive director. We can modify this to executive director if it's the will of the board to retain that title. But that's why it's there. And the version of the bylaws that the attorney had district manager. So it's something we can work through, yeah.
Okay, I believe that's not correct. And I don't know what version Mr. Steele has. However, there was a board-approved vote to change.
I'm not questioning that. I'm not questioning that.
But that has been approved, and I'm just trying to make sure that we understand who we're talking about here. Is this something that Kathy is doing, and how do we make this policy enforceable? If we're going to designate a particular person, if that position doesn't exist?
Okay. If that's your objection to adopting it tonight, and I'm just trying to understand. Okay, I'm just asking the question. We can strike that and through a motion and change it to executive director at this time. Yeah, go ahead.
Okay, my original objection is that we all just got handed this just now. If we're establishing board policy, I think it would be good practice that we get it as a first reading with time to read it and then have an intelligent vote, unless there is an emergency or something down the pipeline that we have to immediately do it. But to rush through the process, if there's no apparent reason for doing that, I think I would prefer that this be considered a first reading, along with the other policy that we just are about to get on.
Well, no, this is the only policy we have tonight. We had a list of several, but the agenda was going to be way too long.
Got it.
Okay.
So
we have an electronic records is also on this agenda.
Oh,
it's the
well,
next
where's that?
Electronic records, retention.
I see. Okay, okay.
Because that could abbreviate the conversation as well, just to say this is first reading only, think about it, look at it. We'll be discussing in detail next time.
Is it, then let's make this simple. Is it the will of the board to accept this as a first reading and defer this to our next meeting? Full consideration to our next meeting. Is that the will?
Yes.
It's my will.
Okay.
I would make that motion.
All right.
I will.
Well, we don't even have to make a motion. That's the will of the board, all right?
Okay, got it.
I just would like a point of clarification. Did anything change in Appendix A or B?
No.
Okay, thank you.
Yeah, it's just the text of
Just
the first.
the front page.
He shortened it up, yeah.
Thank you.
Okay. Okay.
Okay, so Lionel, would you like me?
Then, without objection, I'm going to direct, ask Director Wiley to correct the title here and then we will bring these back at our next meeting for full consideration. All right? Okay. We're good with that? All right. Now then, let me see. I got my papers out of alignment, so I apologize for that.
There you go. This is all you need.
There we go.
This is the last one.
Okay. Okay. Well, yeah.
You got
Okay.
it? Here's mine. You got it.
Okay.
I would like
Okay, I want to go over the last item of business, the current status of our standing committees. We have two standing committees that our bylaws require. The first is Finance. That committee assignments are Director Spring and Director Savage. Chair is the treasurer is the chair of this per our bylaws. Okay? Then there's the Planning Committee. That currently is Vice Chair Katzoff and myself. And the Vice Chair is the chair per our board bylaws. Okay, so hopefully that's clear. Secondly, the ad hoc committees, and again, these are not governed by Brown Act with respect to disclosing our deliberations to the public. They are, however, subject to the Brown Act when they come to the board. So we've had some a little dissent and confusion about that in the past. So again, let me clarify that the ad hoc committees work on things, make proposals, discuss. When they're ready to bring it to the public, that's when it goes to the board members and the public at the same time. All right. So hiring and office. That's Director Savage and myself. Bylaws and policies. Now, we have a blank here, but I'd like to, without objection, appoint myself to that committee to work with Director Savage. Blue Zones is Director Vice Chair Katzef and myself. Board Retreat is Director Savage and Director Spring. Seismic Compliance remains for as long as she's willing to participate, because, my God, what she knows is truly remarkable. Director Finney and myself, plus the consultant teams. Then we have the one remaining issue is the reconciliation of the finances between our two organizations, which are admittedly somewhat complex. So if we can, I believe we need a motion to approve all of these, and I would request that we hold off on the reconciliation of the Adventist Health and the district finances at this point, appointment of that. So can we? The standing committees are not are established by bylaw. That's anyway. Does it make sense? So you have a motion to approve these board committee assignments.
I'll make a motion that we approve the board committee assignments.
Okay.
I just have a clarification question.
Okay, let's see if we have a second first, okay?
I'll second.
Okay, all right, the directors.
Was there other committees that had been made around seismic? Like the communication committee and?
That one was a short term just to look at the documents, and Susan, Director Savage and I served on that one, and we agreed that it was at appropriate time to dissolve that when our work was done, and that is continued with the seismic committee. Okay. And I don't believe there are any other committees, so, okay, we have a, okay, so let's, I guess we can move to the question on this. Oh, do we have a comment?
Yeah, a second.
Well, Paul moved, Sarah seconded, is what I have.
Okay.
Are you ready? Oh, okay. Lee Finney.
Yes.
Paul Garza.
Yes.
Paul Katzef.
Yes.
Susan Savage, yes. Sarah Spring.
Yes.
Okay, the appointments are approved.
Okay, and just to note that we still have to consider this reconciliation of the finances, and so I'll be looking to the advice of the board on who would be best suited to serve in that capacity. I'm assuming that we'd want the treasurer involved in that. Director.
It's done. It's completed.
Yeah,
We finished
It's
it.
finished? Whoa.
We finished going through the reconciliation.
That requires applause.
Yes,
Well,
it does.
when are we going to see the results?
So we finished reviewing the reconciliation.
Okay.
Now the work is to do the reconciliation in QuickBooks.
Okay. Okay, well, that's absolutely good news. Very good news. Thank you. Thank you for that. Okay, we're now at the conclusion, and as Mr. McDonald was so keen to advise us, we have an opportunity now for public expression one more time. Mr. McDonald, do you have something?
Chair, you also have a hand raised on Zoom too after Mr. McDonald.
Oh, okay. Supervisor Williams.
Yeah,
recognized.
This is Ted speaking as a member of the public. I heard from across the room, I heard the motion for approving the ambulance and roof, I think as part of 5C. And I was curious, did the district's council find that agenda language to support the motion that was offered?
I'm not quite sure what your question is. Would you?
Was there a motion for a purchase of an ambulance?
Yes, yes.
Yes, there was.
Was that under agenda item 5C?
Yes.
Yes.
I'm surprised that language. I wouldn't have expected an expenditure.
Okay. Any
Measure
other
C
comments at this
recommends
point?
Expenditures.
So I can cure that comment, I believe, by better backup and analysis to the board for the next time it comes up.
Yes, that's kind of, I think, a persistent theme. There's a whole lot of work that we have. It's going to be a bit more complex. It's going to be very important that reports are submitted with backup analysis and in writing. Director?
Well, if I understood the concern here is that it doesn't look like there was an agenda item for the board to actually take action. Where in previous formats for our agendas, it would say discussion/action, rather than just accept the report, that it allowed for someone to make a motion like we did and actually take action on something.
Okay.
So in terms of formatting maybe of the agenda, we can make sure that that possibility/probability is included in the
Okay.
language that we put in the agenda.
Okay, thank you for that clarification. Now now it's very clear in my mind what Supervisor Williams was concerned about, and raises an important point. So let's be careful. We need to be very careful with this language. Okay, Mr. McDonald.
Thank you. Thank you. I want to not let this go by. I totally agree with Director Savage's comments and treating the 5E and F as first reads. Just 100% on the same wavelength there. I don't have a however or anything on that. The only addition I would say is that having been one of the people on the email list who at 11:00 something this morning received a chunk of attachments that later disappeared, but not after I downloaded them, that had five other board policies that didn't actually appear on the agenda that you're considering. In the future, I would like to extend what Director Savage is saying, that any board policy needs to be pursued in that same way. First read, especially when they're being thrown at the board members, day of or 1 or 2 days before. There's other things in the world going on. There's multiple pages. And I would also request that who is sponsoring them be clearly put, which board member or members be clearly delineated on the agenda. I think if you look at the supervisors' agendas, you'll see that, even down to sometimes it's county council or staff or that kind of thing. It could be staff combined with director so-and-so. That transparency of that will alleviate some of the criticism, I think is the bottom line of it.
Point taken, thank you.
Yeah. In connection, so many pages, I'll probably sit down and kick myself for missing something. I think we progressed a little, baby steps here in the transparency. Got to have the public comments for, Director Garza has pretty much allowed that throughout, so that's a positive. It's just got to be that way, and the raising $20 million or any $1 million through the public is going to be a big thing. Director Katzef was just so spot on in his comments. The rest of you need to take heed. I can't emphasize that enough. You guys are, you've got to find out, get Mr. Johnston's input, get Deveni Group's input on costs of specific things, the specific alternatives. All right, now I go back and kick myself on something I forgot.
Okay.
Could I ask a question before we adjourn? Director Katzef had wanted a special meeting regarding seismic sometime in February. Do you want to calendar that now while we have 5 people here?
All right. Well, this is, for the
Early poll.
phone, yeah, to the poll, yes. Okay, the options would appear to be, because we have a standing meeting would be the 29th. So the options would be, the reasonable options would be the 8th and the 15th. I'd not like to delay this. I think we're all very anxious to get these results. Is there any objection to either one of those dates from board members?
As I recall, in the ad hoc committee meeting, that Robin Garrity was not available on the 15th. That was not
Okay.
going to work.
So that would be very important, Director.
I did not hear, sorry.
Sorry, we were considering the 8th and the 15th.
The 15th, I'm with Rick.
Okay.
So it really is the 8th.
Okay, so it looks like
Sooner the better.
Yeah.
Okay. Okay, so if there's no objection, we will, and hopefully the Redwood Room will be available, but if not, we'll find a contingency. We'll meet again at 6 p.m. February 8th for the poll reveal. We'll call that. Now, we're at the end of the agenda, and in the past, we've had the custom of final board comments, so I'll entertain any comments from the board. And this time is especially for board members to introduce something that we didn't consider tonight that they believe that we should be considering. But otherwise, Director Spring.
Can we put future agenda items before adjournment in
Can
the
we put
future?
Sure.
I'm sorry, what?
It says future agenda items and it's after adjournment, so I feel like if one of us has a future agenda item that we would like to list, doing it after adjournment doesn't make sense.
Well, we could, but what I want to do is make sure that, and we'll get this straightened out, that we have final board comments prior to adjournment in any case. I just think that it's wise, because then, particularly as you suggest, we want to make sure that there's something, if we need to agendize, we can do that. If there's no objection to that, we'll.
Okay, so just to clarify then, since this is listed at the bottom, these are things you've already identified that are on your list for future agenda items, correct? So bylaws and policies is already on there. And I'm going to appeal that we need to get something organized for us to get out in the field and talk to people. I like the model that I suggested to you, but if you have another way of doing it, I don't almost care what it is. It's just that we need to be out there face to face with people, and those need to get out there ASAP.
Okay, and might I then request that that you and I take that on as an ad hoc assignment and try and nail that very quickly?
I'm sorry, say that again?
That you and he take that on as an ad hoc assignment.
All right.
And nail it quickly.
Got it.
And you might want to consult with Craig also about Brown Act issues involved with board members and the public.
Well, and I'm assuming that actual conversations might happen via Kathy for who exactly, we would have a discussion about structure, how that might happen, and then the actual things would be happening.
Yeah, the place and time and things like that, yeah. And of course, I'm also would like to, very keen that we do at least one session in Fort Bragg in Spanish.
To be discussed.
Do you speak Spanish?
What?
Do you speak Spanish, Rick?
No, I don't, but we'll have to get some translators. I do understand a little bit more than I speak, but even that's limited, so I'm a deficient Mexican. But we will find a way.
Okay, well.
Okay. If there's no other comments from board members, then I declare the meeting adjourned. Do we have to have a motion to do that?
Well,
We have in the past.
Okay, let's have a motion to.
Okay, I would like to move to adjourn.
Okay, thank you.
I second.
I don't know who, I didn't catch the second.
Sarah.
Okay, thank you, Sarah, Director. Okay.
Okay.
Call the question, please.
Okay, Susan Savage, amen, yes. Sarah?
Hallelujah.
That means yes.
Yes.
Lee Finney? Yeah. Paul Garza?
Yes.
Paul Casa?
Yeah. Hey, Sarah.
See, I was waiting for you to say no. We are adjourned.
Only one.
Recording stopped.